Welcome. Thank you for everyone for joining us today for the first virtual senior resource fair. If you please take a moment and hit the share button down below to let your friends and family know about this amazing event. We know that there's a lot of people who are going to need the information that's going to be shared today. It is being recorded, so you can re-watch it at any time. You can share it afterwards. That'll be great. If there's something that you weren't clear on, you can always rewind and watch it again. So great, now that everyone has shared this and hit the like button, I would like you all to join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So for those of you who are just joining maybe for the very first time today, I'm Deb Burton and I'm the founder of RI Elder Info. It's our award-winning website. RIElderInfo.com is the most comprehensive, expert-curated online resource for Rhode Island seniors, caregivers, and professionals. The website can be translated into almost every language spoken in Rhode Island. RI Elder Info is a 501c3 nonprofit that serves all of Rhode Island. It's our mission to empower people throughout the aging journey by providing easy, one-stop access to a comprehensive suite of information and resources. Our core belief is that information is power, and no one should struggle to live a healthy, safe, dignified, and happy life from a lack of it. As a nonprofit, we are dependent on the generosity of our donors and our sponsors to bring much needed information and resources to our community. If you'd like to support empowered aging, please send me an email. You can visit RIElderInfo.com and click the donate button. You can click the donate button here on Facebook, happening right up there. You can reach out to me directly at deb@RIElderInfo.com, or you can give me a call at 401-585-0509. We're all about bringing information to the people who need it. The Virtual Senior Resource Fair is one of the ways that we do that. The Virtual Senior Resource Fair would not be possible without the support of the Lieutenant Governor, Dan McKee, and his office staff, who are absolutely awesome, and the support of our sponsors, Oak Street Health, Elder Resources of Rhode Island, Independent Benefit Solutions, Oakley Home Access, Anchor Bay East Providence, Upward Health, Tamarisk Assisted Living, England Studio, and the man working backstage making this possible, Ben Barber of D&B Media. I'd like to share a video with you from our sponsor, our presenting sponsor, Oak Street Health.
with underlying health conditions and the elderly are the most.
Wellness checks for seniors.
93% of your appointments to telehealth.
Thank you so much for your support, Oak Street Health. It really does make a difference in getting the word out to people on information that they need. Next, I'd like to introduce you to Ray Melanson, owner of Next Monitoring and the president of our premier sponsor, Elder Resources of Rhode Island. Welcome, Ray.
Thank you, Deb, for coordinating this amazing event. Elder Resources of Rhode Island is happy to be the premier sponsor for the virtual senior resource fair. Now more than ever, people need information they can rely on. So again, I'm Ray Melanson of Next Monitoring Alert Systems, and I'm the president of Elder Resources of Rhode Island. Elder Resources of Rhode Island is a nonprofit network of professionals that was started by its founder, Leonard Martin, to work together to provide a wide range of services for older adults, their families, and the community. Our mission is to provide seniors with a single source of contact to locate a variety of quality professional services. As a senior or senior caregiver in today's rapidly evolving environment, it can be time-consuming and complex to coordinate the resources needed to address your needs or those of a loved one. So our professionals are committed to finding ways to make sure your challenges are addressed in a dignified and timely manner. To simplify the process, we've developed a network of experts in financial, medical, non-medical home care services, safety, legal services, accounting, as well as real estate related services who work together to offer seniors and their caregivers access to the most beneficial resources from this growing group. Elder Resources of Rhode Island, sets extremely high standards for accountability and performance for our members. All of our members offer an initial consultation at no cost. When you reach out to one of us, you indirectly connect with all of our service providers. So if you reach out to Elder Resources of Rhode Island at elderresourcesri.com, or you can visit us right here on Facebook. So trust is the utmost compliment you can give a professional. It's what we individually seek every day, not just in words, but in our every deed. So thank you, Deb.
Happen if it was not without the support of all of our sponsors: Independent Benefit Solutions, Oakley Home Access, Anchor Bay, East Providence, Upward Health, Tamarisk Assisted Living, England Studios, who actually built the RI Elder Info website, and D&B Media, who is working behind the scenes diligently to make sure that this runs smoothly. But I owe a special thank you to my next guest and his team. Welcome, Lieutenant Governor McKee.
Good morning, Deb.
Good morning, Governor.
Yeah, thanks for having me here today, and thanks for all your, your really wonderful work on this issue that is so important to so many thousand people and live in the state of Rhode Island and all their families. I every time I get on one of these virtuals, I want to remind everybody about the health crisis and the fact that we need to stay healthy. So let's wear our masks, let's wash our hands, keep social distancing, and I think that's a really important thing to say to. To all the people who are listening and caring and taking care of our seniors, and also the seniors that are able to live on their own. We want to make sure that they stay healthy and during this health crisis. So thanks for having me here today. I would want to mention that a couple things I wanted to talk about today that you've asked me to speak to is one is the long-term healthcare council, the coordinating council that was established by state statute. Former Lieutenant Governor Charlie Fogarty was the one I believe who implemented it, and then every Lieutenant Governor after that has chaired the council. This time that I was elected in 2014, sworn in 2015. So for the last several years, I've co-chaired the council with Maureen Maigret, and I can't talk about the Long-Term Care Council, Coordinating Council, without talking about Maureen, who is really a champion and has been a champion for many, many years for senior issues in the state. So what things that we work on together, excuse me, long-term care standards and quality performance and its personal issues, including training and recruitment and staffing needs, enforcement of long-term care regulations, eligibility and access issues. There are members, we meet every month, and we have 40, 50 people every month that are there that are thoroughly involved in the senior issues. And Deb, you're one of those individuals that is there regularly to weigh in, whether it has to do with transportation, whether it has to do with our senior centers, or supporting our senior centers, or our nursing homes, or our home care, patients and individuals that have home care. It's a real comprehensive committee that I have been really privileged to be able to serve on for the last 5+ years, almost 6 years now. Oh my God, almost 6 years. And it's a important information center. And Deb, you're part of the information that gets shared on a monthly basis. But it helped us set up with Rose Jones and others, who's the director of our Health and Aging Department in the state of Rhode Island, and many, many other people who provide tremendous type of presentations. So we take notes on that. We take minutes. Our office does, as you mentioned, our office with Craig Dreyer and Paulette Hamilton and Tabitha Doobie and others that are involved with. We make sure our office gets very involved. Along to Deb and others that are championing the cause of aging healthy in Rhode Island. So we'll testify on issues. So if you have things out there that are important to you, you can contact Deb or contact our office, and then we'll take a close look at areas that might need legislation. We're certainly very interested in the MTM transportation issues out there right now, along with make sure that the small businesses are taken care of, but also more importantly that the seniors get the transportation that they're entitled to go to their doctor's appointments or to their different activities that they want to get to and they're unable to get to. So all our meetings are public, and as I said, we take minutes of those meetings and we post those minutes. So anyone who wants to hear more about what we're doing on the Long-Term Health Care Council, it's an open meeting. Anyone who's interested in the issues are invited and to attend, and we make that invitation to you. One of the things that we've been able to do is set up an executive board. We started on the Alzheimer's issues because when I was elected lieutenant governor, Liz Roberts and her staff had put together a state plan, and I think that we coordinated all the individuals, including Donna McGowan from the Alzheimer's Association, and the different doctors in the hospitals who are really active in the Alzheimer's. Rhode Island is very fortunate to have international, national leadership working on Alzheimer's right now. So if you have a family member, or if you are feeling as though that you're starting to get early stages of Alzheimer's, you should contact our office. There is support out there for families, and again, we become that information center. And we champion, our office championed this 5-year Alzheimer's plan that was passed by the General Assembly last year. This is the first official plan that was passed by the General Assembly talking about Alzheimer's. And the state plan, it's a blueprint for improving support and services for Rhode Islanders affected by Alzheimer's and dementia. 2018, my office embarked on this effort to update the Rhode Island state plan. We knew it was going to sunset in 2019, and we worked with the Alzheimer's Association, as I mentioned, Donna McGowan, raised some dollars from Tufts Health Plan Foundation and the Rhode Island Foundation, $30,000, and we used those to enlist the research services of Splain Consulting, a nationally recognized health policy firm. And we felt that that was very important. We don't have the expertise in our office. I certainly don't in this area. So let's go to the experts to provide us with the very best, roadmap, blueprint to help our those individuals that are experiencing the Alzheimer's disease, and also the families that experience right along with the individuals that are stricken with the disease. We want to end Alzheimer's, but in the meantime, we have to make sure that we're doing everything we can to listen to the people who are in the communities. And we launched a community-based strategy to write this report. We did over 23 town hall meetings in communities around the state. I always say there's 39 cities and towns. They're all important. Everyone who lives in those communities is important. And the families and the individuals who are suffering through the Alzheimer's disease are certainly important to our community. We conducted 45 expert interviews and surveyed over 200 Rhode Islanders to get this report published. And our outreach efforts, we had recommendations, 30 recommendations that came through the report. Was allocate one director level position with the Rhode Island Department of Health to coordinate the implementation of the Alzheimer's plan, and promote Alzheimer's disease and related dementia research opportunities of all types, including federal funding opportunities, to a broad group of Rhode Island researchers. Rhode Island has benefited from our efforts. Just recently, major grants have been provided to the Rhode Island Hospital, the Butler Hospital, to research lifestyles, and so anybody who's interested in participating in those studies, they should let us know. We also are major advocates of diversity in the testing. We know that through the study and through the research that was done on the Rhode Island Alzheimer's plan, that people of color, Hispanic community are more likely to deal with Alzheimer's, and yet we don't have enough diversity in our clinical trials to really kind of help and determine data that will be helpful to all our residents that are dealing with the Alzheimer's disease. So you can review the plan at our website, on the Lieutenant Governor's website. And last year, legislation passed. Senator Coyne, Representative Ackerman passed legislation establishing a formal executive committee, a formal Alzheimer's committee, as we recommended, is working out of the Department of Health right now. Nancy Sutton is co-chairing that with me right now, and we're having regular meetings, and we're very serious about it. And we just completed, and through Nancy's leadership, an application in Rhode Island was selected for a grant, $300,000 grant, federal funding, to help improve Alzheimer's care in Rhode Island. And we know that the work that we did, our office with our partners over the last several years, establishing that Alzheimer's plan, working with the grants that we received to get out into the communities, the informal executive board that we had established, all that data contributed into providing Rhode Island being selected as one of a few states that is going to work with these federal funds. And we know that with the help of Senator Jack Reed and our other congressional leadership, but in particular Senator Reed's office, that we had a good advocate there to bring in funding to the state. And I believe when we're all said and done, that Rhode Island's going to be a leader, a national, international leader, will continue to be in the research, in the data information, to make sure that we're front and center, and we're going to be very aware as we get closer and closer to the cures for Alzheimer's, and so that's what we're working on. We also are doing. We're beginning to start. I think October 8th we'll have some of these virtual meetings again instead of in the community meetings because of the COVID. We'll be establishing a a meeting that with grants that we received recently from from this year from the Rhode Island Foundation and the Tufts Health Foundation. On October 8th, we'll have a Living Alone with Alzheimer's session. We'll make sure that's available to Deb and to all our networks dealing with this very important issue. So, Deb, with that, I will kind of hand it back to you. If anyone has any questions, please let our office know, and we'll make sure we get all this information back to Deb and the leadership that she's provide here with the Rhode Island Elder Info Network.
Lieutenant Governor, before you go, I did have some pre-submitted questions for some individuals that they were going to have to watch this on replay. They weren't able to join us this morning. So the first question, can the state subsidy for the copay funding be increased, allowing agencies to offer home health aides a more competitive wage? And the second part of that question is, can the independent provider program be expanded to include copay eligible seniors?
Well, I'm not sure exactly how that happens. That's part of the debate out there, Deb, and that's part of the effort that our long-term care council gets involved in. So the individuals that are asking that question, they should, contact our office, and I think it's going to need advocacy to make that happen, and that's what this program's about, is advocacy for our seniors, and our office in terms of co-chairing with Maureen on that on those important issues. We can look into that and determine whether that's a policy or regulation or a statute issue, and be happy to follow up on it.
Yeah, that would be great. And I'm looking through some of the other questions here that people have posed, because of course my guests are always happy to answer questions that people are putting in the chat box. Do you know what the status is as far as the senior centers reopening?
Yeah, and so some are, because especially with the food services, they're very active. I was at the senior center in Woonsocket earlier this week, and they're very active, but primarily in the food distribution. But they also they participate in, just like we are today, with different virtual efforts like this. I know that Aging Healthy in Rhode Island we have some other websites that have tremendous activities for our seniors. I don't have that, the web connect here, to tell people the link, but there's major activities that are connecting in seniors in a fantastic way through their senior centers. I'm sure that they are still taking calls. I know that our senior center in Cumberland is taking calls, and those individuals that are looking for those activities that they would have had normally when they're visiting physically the centers, they can get some valuable information out there. There's no reason for anyone to feel as though they're isolated or alone right now, Deb, because the efforts that are happening with like you are today, and our senior centers, and our with Director Jones and others. Please don't be bashful out there. That's the message I would deliver to any seniors or families who have seniors that need help and want to participate in certain activities that they enjoyed. I know our senior center, when I was a mayor in Cumberland, was a major stop-off point for hundreds and hundreds of seniors every week, and I know that happens in every community. So don't be bashful. Reach out. There are programs that are going on right now virtually, and there are some activities that are happening physically. Just seek that out in your favorite senior center that you normally would go to.
Thank you so much, Lieutenant Governor. I really appreciate you coming on today. I think this is great, and you're right. Age Friendly Rhode Island is running the virtual senior center. You can find that on the Age Friendly website. Vin Marzullo is checking in. He's letting us know that AARP is running a lot of programming as well. So if people can see us here on Facebook, we know that they can navigate across the different platforms to be able to get connected to the information that's out there. And right after COVID hit, when everything was really kind of still, well, it is still scary, but right after COVID hit and we weren't really sure what our next steps were, I happened to talk to Bob Robillard over at the Coventry Senior Center, and he said, our doors might be closed for people to come in, but our hearts are still open. So I always think about that when I think of the senior centers. They're still there. They're still working for our seniors to try to get them connected to the information and resources that they need. You might not be able to go inside for some of them, but they are still there, and they're providing a tremendous resource. And like you said, in particular to food for folks.
Yeah, Deb, and I think that they are also continually looking for volunteers. If you're healthy and capable, there's work to be done. It's just different type of work, but it's important work to help our seniors that live in the state of Rhode Island and making sure that they receive what they need. And again, I think those resources are there. I think Director Jones is fantastic, and along with the what you're talking with Age Friendly Rhode Island and your services, and it just goes on and on and on. And our office is we'll do handoffs to people who can help individuals, and we've received those calls just like you have, and then we make sure that the individuals that call, their answers, the questions are answered, and the help that they need, we make sure we provide to them. And whether it's regardless of what community you live in, I continue to talk about 39 cities and towns. Everybody lives in all those communities are important, and the communities that make up those communities are important. So anybody that's in a senior, the families that are servicing seniors, the different facilities that are servicing seniors, they've really stepped up during this time frame. As I was saying, the main goal right now is to make sure we keep everybody healthy, right? Everybody healthy.
Yes. Thank you so much, Lieutenant Governor. And you're right, everybody, wash your hands, wear a mask.
Yes.
Thank you so much for joining us today. I really appreciate it.
Well, we're going to keep on working together, Deb, because you got the energy, and you're really providing these wonderful information strategies to seniors throughout the state of Rhode Island. So thank you for that leadership.
Thank you.
Yeah.
I appreciate it.
Yeah.
So my next guest and I both serve on Congressman Langevin's Senior Advisory Committee together. I would like to welcome next Helen Mulligan from CMS. That stands for the Centers for Medicaid and Medicare Services. Welcome, Helen.
Hi, Deb. I'm happy to be here today to participate in the Rhode Island Virtual Senior Resource Fair. Today I am going to present some slides on the following topics: Medicare open enrollment to include Rhode Island specific information and resources. I will discuss the importance of getting a flu shot this fall. I will also address some Medicare COVID-19 topics. And after the presentation, I will provide some closing remarks. Just wanted to say one thing, that this year is the 55th birthday of Medicare. And today there are currently 62 million people enrolled. And in Rhode Island, there are 224,000 people on the Medicare program. Hi, can you start the slideshow, please? Medicare open enrollment is the time of year when people with Medicare can enroll, disenroll, or switch their Medicare Advantage or prescription drug plans. It's an opportunity to find health and or drug plan that works best for you. Open enrollment starts on October 15th and ends on December 7th each year. Any changes made during this time become effective on January 1st. Next slide. Each year, Medicare plans can make changes to their costs and coverage. Plans are responsible for informing Medicare beneficiaries about these upcoming changes. They can do this either by email or, if requested, by an electronic method. Plans do send 2 documents. One important document is the Annual Notice of Change, which we refer to as an ANOC. And this includes information on changes in coverage or service areas that become effective in January. Plans should send out this annual notice of change by September 30th. Medicare beneficiaries should already have received this notice. If they haven't, they should contact their plan. Plans also send out explanations of coverage, which give more detail on coverage and costs, and this notice should be received by Medicare beneficiaries by October 15th. Next slide, please. In Rhode Island, there are 26 Medicare Advantage plans available for 2021. And there are 27 Medicare prescription drug plans that beneficiaries can choose from. The average cost of a Medicare Advantage plan premium in Rhode Island has actually gone down $2 to $25.03 in 2021. Rhode Islanders will also have access to a Medicare Advantage plan with a 0 monthly premium. The lowest premium for a Part D plan will be $7.20 a month. Next slide. I do want to point out 2 new items of possible interest. For those of you on Medicare who have diabetes and use insulin, new in 2021 is a Part D senior savings model. And seniors who use insulin will be able to choose a plan in their area that offers insulin savings. Participating plans provide coverage of a broad set of insulins, each for no more than $35 a month. There are 9 standalone Medicare prescription drug plans and 13 Medicare Advantage plans with prescription drug coverage that will offer low out-of-pocket insulin costs through the Part D savings model. And starting in 2021, people diagnosed with end-stage renal disease may join a Medicare Advantage plan. In most circumstances, this was not allowed in the past. So where do you get plan information? One source is a Medicare handbook. The Medicare handbook is mailed each fall to beneficiary households unless they have elected to have the handbook sent electronically. CMS began mailing this handbook out to people with Medicare in September, and most should have received it by now. If not, they should be receiving it by this week. In the back pages of this book, there's state-specific information on the available prescription drug and Medicare Advantage plans. And you can use this information for a quick comparison. It isn't comprehensive information, so you can also check with the plan's website or call a plan for more information. Another resource to find plans in the area is a Medicare Plan Finder. This is an online tool where you can search for plans in your area. Next slide, please. One great resource during open enrollment, or in fact, really any time of the year, is the State Health Insurance Assistance Program, SHIP. The SHIP offers one-on-one counseling and assistance to people with Medicare and their families. I really can't say enough about the great services that SHIP counselors provide to people in their community. This year with COVID-19, it will be different. And a lot of cases, individuals will be receiving counseling help via telephone, or like we're doing today, some type of video conferencing. To reach the SHIP, you can dial 1-888-884-8721. You can call the point. Next slide, please. 1-800-Medicare is also a resource where you can enroll or change plans. Just some tips. If you're calling 1-800-Medicare and you have your Medicare number available, say Medicare number when you're prompted to do so. And if you have your Medicare number, there are a number of self-service opportunities available in the automated system. And self-service will allow you to get information quickly without speaking to a customer service representative. But also, if you've entered your Medicare number and you want to talk to a customer service representative, that will already be in the system when you reach an operator. And you can say agent at any time during a prompt to try to speed up the process to talk to a customer service representative. 1-800-Medicare service is available 24 hours a day, including weekends, except for these holidays: Memorial Day, Independence Day, Labor Day, Thanksgiving Day, and Christmas Day. And if anyone needs help in another language, you can let the service representative know. Support is available in more than 250 languages. Next slide, please. Now I want to talk about getting a flu shot. This is no ordinary flu season. It's a flu season amid a pandemic with two dangerous viruses going around at one time. It's time for us to protect our communities by getting the vaccine we already have, the flu vaccine. Getting vaccinated for the flu this fall is more important than ever. Not only will a flu shot help keep you and your family healthy, it can help reduce the strain on our healthcare system and keep hospital beds and other medical resources available for people who may have COVID-19. According to the Centers for Disease Control and Prevention, there's no evidence that a flu vaccine increases your risk of getting sick from coronavirus, like the one that causes COVID-19. Those at high risk for flu complications include young children, pregnant women, and people aged 65 and older, and people with certain chronic health conditions. The CDC does recommend anyone who is 6 months or older get a yearly flu vaccine. Medicare Part B covers one flu shot a year, and you pay nothing for the flu shot if you go to a doctor or other qualified healthcare provider that accepts Medicare payment. The flu shot is available at most healthcare provider offices, local pharmacies, health centers, and other places in the community. So do urge you to get your flu shot. Next slide. I'm just going to go a little bit over some Medicare and COVID-19. Medicare covers tests for COVID-19, and you can get tested at doctor's office, local pharmacies, drive-through sites, and other locations. And there is no out-of-pocket cost for these tests, and Medicare will cover more than one test if ordered by a doctor or other healthcare professional. Medicare will also cover the COVID-19 antibody tests. At this time, there's no vaccine for COVID-19. However, Medicare will cover a vaccine once one becomes available. Let me talk a little bit about telehealth. Previously, telehealth was a very limited service provided. It's only at certain locations and primarily in rural areas. Ever since the public health emergency with COVID-19, telehealth services have expanded greatly. You now have access to beneficiaries have access to telehealth services in a variety of places, including their own home. There's a wide range of communications tools that can be used, including smartphones. They can interact with your providers, like doctors, nurse practitioners, clinical psychologists, and more. During this time, you can receive telehealth visits for common doctor visits, mental health counseling, preventive health screenings. It's just a huge expansion of telehealth that really allows Medicare beneficiaries to visit their doctor from home. And for those who don't have access to internet and don't have a computer, Medicare will pay your doctor for services conducted over the telephone. There have been numerous waivers and flexibilities, including Medicare Advantage plans and drug plans during COVID-19. And, this is really to remove barriers that can prevent and delay beneficiaries from receiving care, and also to make sure beneficiaries get their needed prescriptions. I'm just going to mention a couple, but for those enrolled in Medicare Advantage plans, Part C plans, under the emergency declaration, if a beneficiary needs to go to a hospital or a medical facility that's outside their plan's network, in most cases, this will be covered. This is not just for any, this is for any service, not just if the beneficiary thinks they have COVID-19. A plan must also provide the same cost sharing for enrollee if the service or benefit has been furnished at outside their plan's area. And just one example for Part D, prescription drug beneficiaries are allowed to get a 90-day supply of their medications. There's just some limited restrictions with restricted drugs like opioids or possible shortages of a drug. Next slide, please. Even though CMS administers the Medicare program, it's the Social Security Administration that's responsible for enrolling people in Medicare. So I did thought I'd provide a slide on Social Security. So you can apply for Social Security benefits online at ssa.gov. There's also the national toll-free number. On March 17, 2020, Social Security did suspend face-to-face services in their field offices and hearing offices. However, these field offices are still operating and providing services. To find a local field office number, you can go to the ssa.gov and go to the locator, and a screen will pop up, and you can actually, there's an area where you can put in your zip code, and then you will get information on the direct line to your local office. Okay, you can stop the slideshow now. One thing I kind of wanted to close with, and that's fraud. I just want to tell beneficiaries, you really have to be careful. There's fraud out there, people calling, asking for your telephone numbers, your charge numbers. Medicare will never do that. Social Security will never do it. The IRS won't do it. One of the more recent fraud schemes involves COVID-19, and that's because of people diagnosed with COVID-19. Lots of times there's contact tracing. Well, the fraudsters are out there now calling people, saying that they are, there are instances where they're saying that they're doing contact tracing for COVID-19, and they may be asking for your personal information. And a contact tracer would not do that. So just, beware, guard your Medicare card, and, if you have any questions or you think there may have been fraud, please call 1-800-MEDICARE. And be careful and stay safe. Thank you. This concludes my presentation.
It helps when I unmute myself. A couple things that have come up all the time. A lot of times people believe that Medicare will cover long-term care costs. So if they have to go to the nursing home and they can't return home, there's a thought that Medicare will cover that. Could you speak on that for a moment?
Yeah, sure. Medicare has never covered long-term care, and that's actually ever since the law was created in 1965. Medicare will cover skilled nursing care, and that's only, and this is at a nursing home, and that's only if a patient needs skilled care, and it's only for a limited period of time. And home health, Medicare home health service is limited to skilled nursing, and it's not 24-hour care. It's very limited in certain circumstances. So Medicare has never covered long-term care.
If I, excuse me, if I had a dime for every time someone asked that, I could have a house on Ocean Road.
Yeah.
So I think one of the things I really learned here was the cost of insulin is going down now for Medicare beneficiaries.
Yes, and it's in that if certain plans, I don't have the slide right in front of me. I think it's but the plans that offer that, which can be found through the plan finder by calling 1-800-Medicare. But yes, $35. It's a model, and I think it's great. It's great because insulin costs have gone up so much. It's a great opportunity for those who are on insulin.
I think
to look at those
that's one of those things that we've seen a lot in the news about seniors really struggling with the cost of insulin. Not just seniors, actually. I have
everyone.
I have friends whose children are on insulin, and the cost was absolutely insane. So overall, will the cost for the Medicare plans go up in 2021?
It's all it's the plan. It all depends on the plan, but
Okay.
no, the overall the average the Medicare Part D plans have not gone up a lot, average, and as I said, Medicare Advantage plan has even gone down. The average for $2 a month in Rhode Island, but of course it's everyone's different, and one person can be different even from family members. I mean, one plan could be better than another plan. And the SHIP counselors are wonderful. 1-800 can also help if you have like a list of drugs and you provide that information. They can go on the Medicare plan finder, or you could do it yourself too, or beneficiary could do it themselves. But if you go on that and you list your drugs, it will come up with the plans, what they cover, what the cost is for your drugs. And as I said, it can be different. It can change every year, and different circumstances for different people. But if people are happy with their plans, they can stay in them also, and they'll be automatically renewed.
Yep. And I just wanted to touch on again, Medicare will cover the COVID test, even if you need it more than once.
Yes.
Excellent.
Yes, you'll need a doctor's order, but yes.
Okay. And then, God willing, we will have a vaccine for this horrible illness. Will Medicare cover that vaccine again?
Yes, Medicare will cover that vaccine, and the testing and the flu vaccine will be covered under Medicare Part B.
Excellent. Helen, I really appreciate you coming on today. I think so many times Medicare feels very heavy and overwhelming, and it can feel like I don't know which direction to go or what gets covered. So I really appreciate you coming on today and helping clarify that for our viewers.
Well, I appreciate the opportunity to do so, and 1-800-Medicare. People can always call for assistance, and also, the state health insurance assistance programs. The counselors in Rhode Island, are there to help.
Awesome. Thank you so much, Helen. I really appreciate it.
Thank you.
So my next guest, if you're in her presence, you will notice that she exudes a calm and peacefulness. Don't let that fool you. She is one of the fiercest advocates for elders who have been abuse victims that I know. Welcome, Jean Gattagno, Program Director for the Haven for Elder Justice.
Hey, Deb. So
hey,
I tried to send you a text and a thing on the side. Jean is not in yet.
She's not in yet. Oh my gosh.
Not in yet.
So there must be something going on out there in the advocacy world that she's got to go take care of. So with that, I would like to invite up, let's see, who might we have backstage already ready?
Nobody, except
for
Raymond and Helen, yeah.
All right. Well then, folks, we're going to go to break a few minutes early. It is still going to be a short break, only maybe 5 minutes, but it's enough time for you to go get a refresher on your tea or your coffee, and we'll be back. All right? Thank you.
I'm writing on behalf of my mother. She told me that a week ago, someone at Oak Street Health called her to make sure she was doing okay. I just wanted to say thank you to Oak Street Health for being a godsend for my mother. She has been so depressed until the lady called to check on her. Thank you.
Hi, I'm Dr. Chow from Oak Street Health.
I am Dr. Levine from Oak Street Health. Caring for adults on Medicare is my passion. By focusing exclusively on older adults, we're able to provide them the best healthcare anywhere, no matter their challenges, because that's what they deserve.
The world has changed seemingly overnight. So we're going above and beyond to make sure all of our patients have what they need to stay safe and healthy in their homes. Now more than ever, keeping up your regularly scheduled doctor visits is important to staying healthy.
That's why we're offering telehealth appointments, which are high-quality phone or video visits that don't require you to leave your home. Patients are telling us how much they love these visits.
I enjoyed the home call because my wife and I both could speak with the doctor from the comfort and, most importantly, safety of our home. That was a relief, considering I'm at high risk for COVID-19. My wife spoke for me as I listened by her side. She's better at talking to physicians, so I'm very pleased with this appointment because normally my wife is not able to go with me.
Plus, our 24/7 patient support line puts you in contact with a care team member day or night, because your health matters to us around the clock.
It's never been more important for you to have a preventive health care plan in place and access to a care team that listens to your needs. So call and schedule a visit with us today. Our commitment to serving our communities is stronger than ever.
And it's the reason why we will be here for you, always.
See, run things in lifetime and things come up. Did I say I am extremely grateful to our sponsors, and this would not be possible without them? So far, there's been so much great information. If you haven't already done so, please like and share, because there's a lot of information that people really need out, that they really need to know what's happening. So we had our little break. I hope everybody got their new cup of tea or cup of coffee. Cheers, everybody. It's not possible without the support of our sponsors. I would like to welcome, if he's there, Nicholas from Independent Benefit Solutions. Is Nicholas in?
Not yet.
Oh, he's coming in. See, our timing is all thrown off, but our friend
That's
Jean is here, right?
She sure is.
Yay. Awesome. See, now we'll get back on track.
I'm not computer literate, so.
And that is perfectly okay, Jean. I really appreciate you coming on. You know,
Well,
these things happen, the best laid plans, right?
yes. Sorry.
So this is my friend Jean, and Jean really is an amazing advocate for elders who have been abused. Please share with us what it is that you do.
Thank you, Deb. Thank you so much for the opportunity of being here this morning. And this is really a wonderful program that you're putting on. I'm Jean, and I'm the program director of a program called the St. Elizabeth Haven for Elder Justice. Ben, could you put the first slide up? We're a program that began in 2009. It happened as a result of people from the St. Elizabeth community attending a national conference where the issue of elder abuse was on the agenda. And there were people at that time creating shelter programs for elders across the nation. And when the staff from St. Elizabeth came back to Rhode Island, they created the Haven. The next slide, please. The Haven is a safety program. We work with elders who are abused or who may be abused. We provide a shelter, a temporary place, while we work with people to find a better situation for them. And for those elders who are in need of help, but don't want to leave their homes or enter a shelter, we provide a community-based program. What we do is we provide a safe place. We work with our partner organizations. We work with the state of Rhode Island, the Office of Healthy Aging. We work with the community organizations. We work with the police. We work with the Attorney General's office. And our intent is to bring people together to really look at what all the possibilities are that we can present to an elder so that we can move them from an at-risk or a dangerous situation into a long-term safe situation. Could we go to the next slide, please? You know, elder abuse is called the silent epidemic. 25 years ago, we were all working on issues of child abuse, and we have worked successfully on those issues. And we worked on issues of domestic violence, but elder abuse is really just coming to the forefront. And for those of us who work with elders and work in the field, we call it the silent epidemic. And we call it that because only one elder in 24 who are abused is actually reported. And that's largely because the problem of elder abuse happens in someone's home, so that there really isn't anyone looking for a situation that might be dangerous. And elders don't report. They're afraid. Elders don't report because they're afraid that people won't believe them. They're afraid that they're going to lose their independence. They're afraid of being institutionalized. They're afraid of being at a loss of the social supports that they have. They're also afraid of being retaliated against by the abuser. And sometimes their cognitive decline and illness may prevent them from reporting themselves. For the rest of us who work in the field, for those of us, we don't report because we don't have proper training to help identify what's going on. We also are afraid of making a judgment that we might make a mistake in reporting. And we just don't understand sometimes the signs and the prevention and the reporting aspects of elder abuse. That slide, the slide that's up, is just a list of brief descriptions about elder abuse. When I talk to people about elder abuse, many people are so surprised that it exists. And I think that's because we don't recognize it or we fail to see it. So I try to use every opportunity to kind of give people an idea of what to look for. You know, elder abuse is physical, it's sexual, it's psychological, it's neglect, intentional neglect, and it's financial exploitation. Just think that there are 1 in 24 cases of abuse that are not reported, and that there are people who are suffering in these situations without our knowing, or with our knowing and not recognizing it. When I talk about financial exploitation as well, I'm not talking about scams. Financial exploitation is usually done by family members or caregivers or people who are trusted by the elder. When I talk about neglect, it's not self-neglect, but it's intentional neglect. And that's neglect of proper care for an elder, it's lack of medication, it's not feeding them. Psychological is mistreatment, it's harassment, it's threats, it's verbal abuse. Physical, of course, is more prominent. You can see the bruises or the restraints, so that all of these are very dangerous to an elder. And oftentimes, an elder suffers from more than one type of abuse at one time. Can I have the next slide, please? You know, education is key as we move along in the area of elder abuse, because people don't know, because people don't recognize, because people have fears. It really is important to do education. The St. Elizabeth community received a federal grant from the Department of justice just a year ago. And what we will be doing in the future is providing education and training to law enforcement and to social service organizations. We'll be doing that through a virtual training program after the first of the year. But it absolutely is key that people, all of us, recognize what's going on for an elder and that we take action. Some of the signs are the unexplained injuries, that you see that an elder is very fearful, sudden inability to take care of themselves, to pay their bills, to feed themselves, changes in appetite, loss of weight, their personal hygiene changes. They don't know their own personal finances. They have unexplained health changes. Elders who are abused experience illness at a more rapid rate and more serious illness, and they are likely to die at a much earlier age. So it's really critical that we intervene. It also is important to look at the dependency of adult children and the caregivers around the elder who are dependent upon the elder's money to take care of them. And then, of course, there's the whole issue of unauthorized withdrawal of money, taking over of properties. The next slide, please. You know, how elders can take care of themselves. You know, we need to encourage people to tell somebody, talk to a doctor, talk to a priest, talk to a friend. We need to encourage people to seek medical treatment. Talk to the doctor, take care of yourself. Don't give your social security number or your credit card numbers out to anyone. And don't share the financial condition, your financial status with anybody. Don't sign documents unless somebody you know and truly trust will help you to decide whether you should or not. And don't live with someone who has a history of violent behavior. Next slide, please. For those of us who have family and friends, things that we need to do is to visit elder people, especially those who are isolated, often. We need to look and we need to listen to them. We need to work with them in the privacy of their home or in their own privacy. We don't want other people involved in the conversations. We want to find the resources to help, and we want to speak up. We want to look for things that are wrong, and most of all, we want to report. Next slide, please. Most people don't realize that in the state of Rhode Island, there is a law that requires every person in the state, no matter who you are, if you suspect an elder is being abused, you must report. This has been a law for a long, long time, but people are unfamiliar and don't really follow the law, even when they know the law. But it is critical. None of us want to be the person who knew something was happening, but only spoke about it after the elder is severely injured or dies. None of us want to be that person. It's important that if you suspect abuse, that you report it. And in the state of Rhode Island, we report it to the abuse helpline, which is operated by the Office of Healthy Aging. And that number is 462-0555. What's important to realize and to understand is that it's not our role, it's not our purpose to investigate or to determine if there's abuse. We just need to have a suspicion, a reasonable suspicion. It is the role of the Department of Health, the Office of Healthy Aging, really to do the investigation. Let them, they're the professionals, let them determine whether there's something going on or not, but make the call. Please, the next slide. The Haven works with elders who have been abused or who are at risk of being abused. And we work with elders who are male and female. And we do serve a lot of males, which is unlike other areas of abuse. The people that we work with are 60 years of age and older. They're victims of abuse. They're in need of temporary shelter or in need of safety planning in the community. They are referred to us by the Office of Healthy Aging and other collaborative agencies. And those agencies, again, are CAP agents, community action agencies, health centers, hospitals, the Attorney General's office, police. But to make a referral or for more information about the Haven, please feel free to call us at 244-5476. All referrals that we receive, we report back to to OHA. I didn't change that screen. Because it is their role to do the investigation and their role to do the determination. I'd like also to let people know that if you make a call to OHA, you can do that anonymously. Many people are afraid. Again, they're afraid that they've made a mistake or that they're wrong, or their neighbors, the individual they're reporting about will know who made the report. You can do that anonymously. What really is critical is that you are aware, and if you have a suspicion, that you report. The next slide, please. You know, elder abuse can be prevented. There are 5 million people every year in America who are abused, neglected, and exploited in America. That's a horrendous situation. You know, the consequences our elders are grave, greater health cost, increased nursing home placements, premature deaths, billions of dollars in losses of money and property. So I would ask everyone, please look, please listen, please protect, and please report. Thank you for this opportunity. I can't hear you.
I did it again. Technical hiccups there. One of the things I think people may be nervous about is, can they report anonymously if they suspect something's going on?
Absolutely. And I think that most people do. When professional people generally don't, but neighbors and family members, they often do it anonymously. And they do it for the same reason that elders don't report themselves. They're afraid of making a mistake. They're afraid of causing difficulty for the elder. So people do it all the time. It's important to report. Let the professionals look at the situation and decide what to do about it.
I think that's just so important. And one of the things that you said really kind of stuck with me, and that was, you don't want to be the person who knew that it was happening and didn't say anything, and then something really bad occurred. And you said, well, I kind of suspected, but I never spoke up.
Absolutely. And we've seen that, you know, in other kinds of abuses. When a child is abused, how many people have watched it over time and didn't do anything? And it's the same with elders. It's important to be with elders. It's important that when you know someone is isolated, that there is a constant contact, so that there is opportunity to look, to listen, and if need be, to report.
Thank you. Thank you so much for sharing this important resource. I think I would love to have this like yelled from the high hills here in Rhode Island, that there is help available, and that, you know, if you think something's going on, say something. It's so important. I know the number has come across the screen a number of times. It's in the chat. You know, if anybody ever thinks something's going on, please speak up.
And Rhode Island is very rich with people who work together. to try to help elders.
Yes.
And we all work together. So no matter where you enter your concern, whether it's with a case manager or the hospital or the police, it all comes around to the same group of organizations and professionals to work to circle around the individual and really help as much as possible.
Well, thank you so much for joining us today, Jean. I really appreciate it.
Thank you. This is a wonderful opportunity. Thank you.
So like I said, it's really important to have people that you can trust. We've had lots of great information going on here today, and it really wouldn't be possible without our sponsors. We've got Oak Street Health and Elder Resources of Rhode Island, Independent Benefit Solutions, Oakley Home Access, Anchor Bay East Providence, Upward Health, Tamarisk Assisted Living, England Studios, and D&B Media. So now I would like to welcome our break sponsor, Nicholas Pacheco of Independent Benefit Solutions. Welcome, Nicholas.
Thanks, Deb. Good morning, everyone. Hopefully you can hear me okay. Good morning. My name is Nick Pacheco. I'm the owner and a licensed independent agent with Independent Benefit Solutions. I want to first say a warm thank you to Deb Burton for all that she does for Rhode Island Elder Info and putting on this amazing virtual senior resource fair. Thank you also to the other sponsors and speakers, such as myself, for putting this comprehensive benefit fair together and coordinating the resources necessary for our beloved seniors whom we all serve, and I've been serving for 19 years now. You truly are the greatest generation. As a public service announcement, remember that the Medicare annual election period is happening this year and every year from October 15th through December 7th. Anyone who has health coverage through Medicare can either review, enroll, or change their Medicare plans, including the standalone prescription drug plans. As many of you may know, Medicare is designed for individuals who are age 65 or older or under age 65 with certain disabilities. But original Medicare does not cover prescriptions, dental, vision, co-pays, or Medicare's deductibles, and only pays 80% of the bill. The annual 8.5-week window not only allows people to review their plan and see what options are available, it also allows them to go from one plan to another with an effective date of January 1st. However, please keep in mind about the government deadline of December 7th, Pearl Harbor Day. That means anyone who misses the cutoff point will not be able to change their plans unless they have a limited number of extenuating circumstances or qualify for a special enrollment period. Medicare is run by the federal government, but plans are administered by private insurers. Maintaining a healthy lifestyle while not being concerned about how to pay for potentially devastating healthcare costs is a difficult task for some. We understand that. For most people, they often find themselves confused as to which type of plan or carrier to go with, or simply haven't reviewed their plans in a while to see which benefits they may be eligible for, or they're finding that their prescriptions or their co-pays are too high. Fortunately, there is help in ensuring making the right decision. I, along with my other licensed independent agency members, are appointed with many carriers with a goal of saving our clients money on their premiums and prescriptions and making sure they are aware and getting of all the benefits that they deserve. Our desire is to help people select the best insurance coverage based on their needs, their health, and most importantly, their budget. We work with each client to select the right plan while ensuring the access and affordability to care while giving clients complete peace of mind. Independent Benefit Solutions provides a myriad of other services in addition to Medicare plans. We also help our clients on how to maximize their Social Security benefits, plan for a predictable retirement income stream, and how to leave a tax-free legacy to their loved ones as they plan for final expenses, among other services. Using a comprehensive approach and open architecture, we work very closely with each client and using our strategic referral partners, such as Deb from Rhode Island Elder Info, for example, to develop a tailored plan to fit our client's lifestyle, goals, and budget. For more information about the Medicare annual enrollment period, Independent Benefit Solutions, or our menu of services, please check out our website, which has been scrolling across your screen at independentbenefitsolutions.com, or give us a call. We're local at 401-314-4100. Thank you for allowing us to be part of this amazing event, Deb. Back to you.
Thank you, Nicholas, and thank you for your service, Nicholas.
You're welcome.
I would like to welcome my next guest. She has the Herculean task of being the administrator for long-term services and supports at the Rhode Island Department of Human Services. Welcome, Sarah Harrigan. Sarah, you're muted.
There we go. Thank you, Deb. Thank you so much for having me here today. My name is Sarah Harrigan. I am the Long-Term Services and Supports Administrator at Department of Human Services. We oversee eligibility for long-term services and supports. I saw in some of our comments earlier today, there were some questions about what are the options for paying for long-term services and supports. And I'm here to talk about Medicaid and the Medicaid option. I am going to share a presentation that I have for you. All right. So today we don't have a ton of time, so I just wanted to talk about three really important questions. What is Medicaid LTSS? Who is eligible? And how do we apply? So to start with, LTSS, like I mentioned, it stands for Long-Term Services and Supports. It really is a spectrum of services covered by the Medicaid program. It is Medicaid plus this wraparound of long-term services and supports. It is to assist people who have chronic or disabling conditions and that really need assistance with some of the activities of daily living. So that is eating, bathing, dressing, moving from one location to another, going to the bathroom, moving around, walking around. For folks who need assistance with that, this is what LTSS provides help with. The specific types of services, so there's really a wide variety and is based on a review of your needs and functional assessments, as well as review of clinical documents. We'll talk a little bit more about that process momentarily. But some of the services include having an agency provide CNA services in your home, providing special medical equipment, some modifications to your home, such as ramps. Those things can be covered if you are eligible for Medicaid LTSS. Additionally, on the higher acuity level, LTSS is the Medicaid LTSS is the primary one of the primary ways that skilled nursing care is paid for. If you or a loved one do need to go into a nursing facility and determine that that is the best choice, LTSS Medicaid can help pay for that. But there's also a spectrum of services for folks who do want to stay in their home and age in place, a variety of ways that you can get the assistance that you need. So who is eligible and what does that process look like? So to start with, LTSS, it is Medicaid. So there is a review of finances, but more importantly, there's a review of your clinical need. So all applicants are going to be asked to submit specific medical documents. One of the documents is something that is reviewed and signed off on by your primary care physician. And these are reviewed by nurses at the state of Rhode Island to determine that a clinical level of need is met. And in addition to these medical documents, if you are seeking services in the home, you will also receive an assessment by a social worker who will really help talk about what your goals and what your challenges are and help provide additional information to what the physician is providing. In terms of financial eligibility, there's not a very strict income limit. I'll talk about that more. There is, if you are making more than $9,000 per month, you are not eligible. Most people do not meet that. what happens in most cases is that we do ask you to provide or contribute to your cost of care. So as we go through LTSS eligibility, one of the things that we determine is how much the state will ask you to pay to contribute towards your care. There is a very strict asset limit. Assets must be under $4,000, and that is your checking accounts, your savings accounts. We do review trusts and other assets such as a secondary home or secondary vehicle are considered assets, and that asset limit is $4,000. One other important item I will touch on a little bit more is that if there is a married couple and one individual is seeking eligibility for LTSS, the income and assets of the spouse are reviewed as well. There are definitely special considerations provided. We are not asking the spouse to contribute everything to that individual, the other spouse's cost of care, but that is part of the eligibility process. So some important considerations. I really wanted to highlight these 3 items because these are the most frequent questions that we receive when you're considering your eligibility for LTSS, Medicaid LTSS, and if this is the right path for you. I mentioned real estate, a second home. If you are receiving care in a nursing facility and you are not planning on returning home, the state does ask you to sign a waiver, realizing that the state may place a lien on your probate estate. If people are a disabled child or a spouse is still living in that home, that lien is definitely not enacted. But we do want people to know up front that real estate is considered an asset when you are applying for Medicaid LTSS. Another component, which is really different for folks who have applied for Medicaid or a SNAP food benefit program, any other benefits, is LTSS does a full 5-year financial review. The reason for this full 5-year review, and we do use electronic verification of banking records, we review assets for 5 years to see if there has been a major transfer of resources. These transfers may disqualify folks for a certain period of time if there was a transfer of funds for something that was less than fair market value. So if you sell your home, but at much less than fair market value, the difference between the fair market value and what you sell it for, we would look at that for possibly a disqualifying transfer. There are pages and pages of regulations on this, and if this is something that comes up during eligibility, it's certainly something that you can talk to an eligibility specialist about. But again, we do want to flag up front that this is part of the process for eligibility. And then finally, cost of care. I had mentioned this previously, but this is a big part of our conversation with folks who are applying. When you apply for long-term services and supports, you provide information about your income. And we take from your income, subtract living expenses, a personal needs allowance, expenses that you might have based on if you have a spouse in the community, any additional Medicaid or healthcare premiums that you are paying. But the remainder, a lot of folks do have a remainder, and that is what we would consider your cost of care that we ask you to provide to your provider, your nursing home, your assisted living, your home care provider on a monthly basis in order to keep eligibility for long-term care Medicaid. So how do we apply? This is where I did want to spend some time today because I know a lot of folks have questions about the application process. There's 2 ways. You can apply online or you can apply using paper documents and mailing that in. Online, you can apply at healthyroad.ri.gov, and you're going to want to apply for health and human service programs. So this right here is where you're going to get the application that you'll need to get LTSS Medicaid. Applying for health coverage does not get you to all of the questions needed for long-term services and supports. A lot of folks find that they do need some additional assistance in the application process. So you can find all of the supplemental documents on the website. This is a long website. I apologize for that. If you do use Google to identify it, you can search for Rhode Island LTSS application, and this site does come up. We'll say we're also in the middle of doing a review of our websites to make sure that they are much more user-friendly, but all of those materials are online. If you do find that you need assistance, there is assistance available to you. So the Point is a agency that can help make sure that you understand what options are available for long-term services and supports. They can talk to you about both your Medicare coverage and your application for Medicaid coverage. And they can be reached at 462-4444 or at 211. This is a great resource for questions that you have about LTSS. They may get you in touch with a specific agency who can help you walk through that application process. Additionally, you can always call Department of Human Services. So we have a hotline that we do pick up daily between 8:30 and 3:30. You can contact us at 415-8455. You can call and ask for an application packet to be mailed out, or you can call and ask questions that you may have about your application and application process. And again, the DHS direct number is 415-8455. DHS does have 6 field offices. Right now, due to COVID-19, they are closed to the public. So we are doing all of our customer service via this phone model. So that is the best number for you to call. 415-8455, and you can be connected with a LTSS eligibility specialist. So what do I need to apply? Unfortunately, this is a program that requires an awful lot of documentation. The first step is the DHS-2. This is the application for assistance. This is the Department of Human Service application for assistance, and you can see here that it is a single application for all of our benefit programs. You are going to want to make sure that you choose LTSS, Medicaid Long-Term Services and Supports. On this application, it is about 40 pages. It does have some questions, many questions you will not need to answer because they are specific to other programs. So always look at the question, make sure it says LTSS next to the question. If it says LTSS, that is something that we need you to answer. And we do ask you questions about your income, about your bank accounts, about any supplemental insurance that you might have, and also if you have a spouse and spousal information. There is supplemental documents that are required in addition to that application. And again, this is why a lot of folks find it really useful to either call the Point or call DHS and get some assistance and guidance in filling out this application. We're happy to help. You can find all of the documentation, like I said, on the Executive Office of Health and Human Service website. We are continuously really working to improve our customer-facing websites and make sure that they're as easy to find and as easy to use as possible. I want to just touch on a few documents that are required and why. So the cover sheet, right here, there's an application assistance cover sheet. I'll show you a picture of it. This is kind of what it looks like. It's one page. We really recommend filling this out. and putting it on top of your application if you're using a paper application, because it really helps us identify if you know already what service you're looking for. If you know that you are entering a nursing home and you're seeking nursing eligibility to cover your nursing home stay. If you know that you're looking for a self-directed model, you have a loved one that wants to be providing that service for you, and there you are seeking Medicaid eligibility so that individual can get paid to provide those services. That is really helpful information for us to have up front. It can help the eligibility process go really a lot faster. We also have a couple of documents here, the DHS 25 and 25M. These are disclosure releases. The first one, DHS 25M for medical, that allows a release of health information. And like I had said earlier, clinical eligibility is an important component of this program. If you sign this form and fill it out, it allows us to understand which providers we can communicate with. So if you are in a nursing facility or an assisted living facility, it is really helpful for you as well if we can communicate directly with that business office and receive some of your clinical documentation directly from them. The DHS 25 lets us know who we can talk to about your application. So if there is, oftentimes there's a son or a daughter, a guardian, or sometimes it's your provider themselves, that you say, you know, it's okay. DHS can talk directly to these folks about the application status and what's needed. That is really important for us to have. And again, it can really help move the application process a little bit faster if we know who else we can talk to really help move the application through. There is a document, it's called the CP12. This is just a notification of recipient choice. This is important for us to have because we do want to make sure if you have gotten to the point of filling out an application and you are saying that you want services in one specific setting, we want to make sure that a conversation has been had, that you understand that you do have choice in your setting, that there are opportunities for you to stay at home or to move to an assisted living facility or a nursing home care. There's a variety of setting options. And then finally, last but not least, regardless of what setting you are receiving LTSS services in, you will need a form called PM1. This is a medical form that your primary care physician, usually it's a primary care physician, will fill out on your behalf. So this is the cover sheet. Again, I just wanted to show this. I could spend an hour talking to you about all of the different services and different programs within LTSS. But I did want to just take a second to highlight these are where some people choose to receive their services: in a nursing home, in an assisted living resident, in somebody else's home who will be assisting and taking care of you. These are kind of key indicators that we look at to help move your application as quickly as possible. Few tips before I open this up for questions. I have mentioned previously, spousal information is really important. This is often where we find we stop the eligibility process to call a client or to ask for more information. If you are married, we want to be able to take your spouse's information into account, and also their financial needs into account as well in determining that cost of care. So your spouse's information is really important, including their date of birth and their social security number. That should be on the application, whether you're applying online or on a form. And again, listing any income that they have, any asset information that they have is very important to making sure that we get the correct cost of care. Please make sure you sign each page. If an application is not signed, it does get sent back. So it takes some work to put together all of this information. We really want it to go as smoothly as possible. So please take the time to make sure that the signatures are on there. Keep a copy for your personal records. I really do recommend that. It can be very, very helpful to have your own copy on hand with you or a loved one or a trusted provider. And then the time frame. So LTSS eligibility should be determined within 90 days. Our average right now for most applications is about a little over 2 months. It's about 65 days for most applications. Some applications, especially those with complex financial information, so there are trusts, there are intentional transfers of assets to become eligible for Medicaid. These do tend to take longer. And we currently do still have a backlog. We've got about 150 cases that are currently pending over 90 days. That is a lot lower than some numbers that we have had previously, but I do want to make sure that folks are aware of the time frame and the fact that because there is a clinical eligibility review and a financial review, the eligibility does take longer than eligibility for other services through the state. So one more slide and then we can turn it over to questions. I think that we do have a lot coming in. The last thing that I really wanted to share, and I do get this question a lot, especially from advocates in the community, what happens once I submit a paper application? What happens in those 90 days? So this is a kind of a high-level overview, but I wanted to make sure that we were shedding some light on what the actual process is and what might be happening with an application once it is submitted. So it's entered into Bridges is what we call our eligibility system. An application is submitted. If it's in paper, it does get scanned right away within the first day into our eligibility system, and all of the supporting documents are organized and submitted into that system as well. The next step, within the first 30 days, hopefully significantly less than that, we do an initial review of the application. We enter all of the data into our system. We do an initial financial review. We send a request to an electronic asset verification system to do that full 5-year review so that you don't have to send 5 years worth of bank statements in with your application. At the same time, assuming that we have all of the medical documentation that we need, we are sending this to our nursing unit for a medical review. So the initial review will check for completion. It will send a request, or we'll give you a call if we need any additional information. And then we're sending it for a clinical review at the same time. If you are receiving services in your home, we will need to set up a time for a functional assessment. Right now, those are still happening over the phone. Historically, it's definitely been an in-person visit, but due to COVID, we want to make sure that everyone stays safe, and we are doing setting those up over the phone. After we have all of that information, we've found you eligible financially and from a clinical perspective, that's when we do the cost of care and identify how much of your income we'll be asking you to pay towards your services. Then we authorize, you will receive a lengthy notice in the mail that provides details on eligibility and time frame and the cost of care. And that's when we send in, and this is especially for our community partners, we send information to any partner agency that may be assisting you, and the eligibility information is sent to our billing system so that providers can start billing. So with that, I want to say thank you very much for taking the time. I will leave this line up for a little bit. Or this slide up for those of you who want to take down the phone number or my email address. And I am happy to answer any questions if you have some.
Oh, the questions are coming in, just like I expected.
Absolutely.
Um,
Happy to answer some. If
let's-
you could help me keep an eye on them, I wasn't able to keep track of.
Yeah, no, that's great. So Ben actually had a question. How soon after Medicaid is approved would you know if there was a lien on the primary property?
Well, the lien does not happen right away, and the lien does not happen until the estate is in probate.
Okay, that's great. And so one of the things when you're qualifying, this is a pre-submitted question, when you're applying for Medicaid, are there certain expenses that reduce what your income is? So if you had to say pay out of pocket to renovate your bathroom so that you could get your wheelchair in.
Absolutely. So we call this spending down assets. And there's most ways that you spend down your assets are qualifying ways. One recommendation that a lot of folks have is prepaid funeral expenses. But also, if you're spending money on your home, on your taxes, that's not going to count against you when we are doing financial eligibility. What we do look at is transfers of sums of money that you're selling something for below the fair market value, or you're giving either money or assets away. That is when we would look into whether there was a disqualifying transfer, and potentially put in place a period of time where you would be eligible but for the transfer, and we would kind of pend what we were able to pay for a certain period of time. But other expenses that would reduce your income are definitely anything related to healthcare. So your health insurance premiums, if you are paying out of pocket for medication, unpaid medical bills, anything that is unpaid up to 3 months prior to the point of eligibility, submit that with your application. We can review that.
Awesome. So I'm going to ask a question that was actually submitted to the Lieutenant Governor that I think you might also be able to give more information on. Can the state subsidy for the copay funding be increased, allowing agencies to offer home health aides a more competitive wage? And can the independent provider program be expanded to include copay eligible seniors?
Those are two great questions. So the first question is about the copay program. The copay program, I'm not sure if you've had someone on talking about that. Sometimes because of the high cost of care, or for whatever reason, LTSS Medicaid is not the best way to go. We do have a great program through Office of Healthy Aging that allows you to pay a reduced price for home care services. So that is the copay program. Was the question, can the rate be increased or the income be increased?
The rate.
The rate be increased. I can definitely bring that back to the Office of Healthy Aging as a recommendation to look into. I don't know off the top of my head when the last time that was updated, but we can certainly bring that back.
So Shannon Crow brings up a really good point, and it's something that we're seeing really across the state. It's kind of long to bring on the screen, so I'm just going to read it. She said, once an applicant is approved for long-term care, are they able to contract with a home care agency of their choice? She finds that many of her residents have approved long-term services and supports, but are not receiving home care due to the CNA shortages. She tells them to call the Office for Long-Term Services and Supports in Cranston and speak with the case manager. They get feedback that they've taken this step, but then they still aren't getting the help that they need.
Yeah, that's a great question. So the answer in short is yes, you do have choice over which agency provides your care. However, the agency, if the payer is Medicaid, the agency has to be willing to accept Medicaid. Our caseworkers do work with all of the Medicaid providers to really work on getting hours filled and getting people the care that they need. There is a shortage of CNAs working in home health agencies, and we find that especially in certain pockets of the state, we have a very, very hard time making sure that folks are connected with an agency that can serve this. There are a couple of other options, and I would encourage folks in this scenario to really look at the self-directed options. The independent provider is a model where you identify a friend or a family member, or we help really put you in touch with someone who is an independent provider. They are not a licensed CNA necessarily, but they are someone that you decide you trust to help you with the goals that you have, be it you need help bathing a few times a week, or you need someone really helping you with meal preparation. Whatever those items are, if there is someone in your life who is doing that for you or is willing to do that for you, if they were able to be supported and receive a wage for doing that work, that is, you can really look into the IP program for that independent provider. There are other models of self-directed. So shared living is if you are living in another individual's home and that person is taking on the responsibility of caring. And then personal choice is a third model where you are not necessarily living in someone's home, but you receive your own budget through Medicaid, and you use that budget to pay directly for CNA. It could be through an agency, or it could be paying directly privately a CNA or another care provider to assist with your needs.
Awesome. So there is a question from Elizabeth Bodie. She wanted to know if you could go over the 25M and the 25. They can be confusing.
Yeah.
We're kind of
Sure.
butting against some time limits here.
Sure.
So
Sure.
I'm wondering if that's something you might be able to answer, and then I can reply to Elizabeth later, or if you can go in, she's right in the Facebook feed, and answer that question, if that might be possible.
Absolutely. So Elizabeth, those are the 25 is to be able to communicate about the financial information on the application and the application process. The 25M is specific to medical information.
Okay, that's good. I think that this was so very helpful. There is just one really, hopefully, quick question. If somebody is in the community and they're receiving long-term services and supports, and unfortunately they're no longer able to remain in the community, and they need to go into the nursing home and remain in the nursing home, does that approval transfer with them into the nursing home, or do they need to redo the paperwork?
That's a great question. They need to apply for a program transition. So we have a one-page form that's called a program change form. It can be submitted for a financial change or because there's a change in need and you need to move your setting. What would need to happen at that point is we'd need to do another clinical review, but we would not need to do another full financial review.
Awesome. This has really been amazingly helpful today, Sarah. And I might actually have you come back on another time to talk even more about this, because I know that this is something that a lot of people really struggle with and feel that, you know, they really need to hire an attorney to do this and get very overwhelmed with it. So I am so appreciative that you were able to come in and speak today.
Well, thank you so much for having me. I welcome those opportunities to shed light on this. I know it's a confusing process, and I'm really happy to help in as many places as possible.
Awesome. Thank you so much, Sarah.
Thank you.
So my next guest has worked with older adults for over 30 years as a social worker, adult protective services worker, even a prison discharge planner, and now as the Healthy Aging Behavioral Health Liaison at BH Link. Welcome, Stephanie.
Hi, thanks so much for having me, Deb. Hope everybody can hear me. Yes, 30 years. I started when I was 5. Only kidding. Only kidding. Yeah, I'm so happy to be here. Behavioral health for our seniors, for people 60 plus, is so very important. And so let me give a little bit of an explanation. I have to be a little quick today, unfortunately. I have an appointment that I have to go to after this, but BH Link is Rhode Island's only stand-up emergency service provider that is a 24/7 walk-in clinic over in East Providence on Waterman Avenue in East Providence. And so this was a dream of the governor and some people, many people over at the Behavioral Health Department. We work with BHDDH. This is a grant program, a 5-year grant program. We actually have a physical facility that people can go to visit. And instead of going to an emergency room, they would come to BH Link and get services to link them to the next appropriate level of care for their behavioral health needs. So if somebody had a mental health crisis, if someone had a substance use crisis, they could come to BH Link and we would get them whatever help they need. We don't do actual clinical treatment at BH Link, but we do provide them to that next level of care. So we would arrange for them to go to a hospital. We would arrange for them to go to some type of drug or alcohol rehab. And so that's what we do. We have a 24-hour line also. It's 414-LINK. You'll see the number below. And that number is a number that people can call, providers can call, with questions about whether or not they should come to the link or whether or not a clinician could speak to them on the phone to give them direction and help with whatever their behavioral health issue is. That number also answers the 1-800 National Suicide Hotline. I'm very proud to say that we were just recognized nationwide by the National Suicide Hotline as having a 99% call answer rate. We have the largest rate in the country right here in Rhode Island. And all of those suicide hotline calls are answered right at BH Link. So what makes us different than going to a traditional emergency room is that when you go to a traditional emergency room, if you're having some type of behavioral health crisis, you're mixed in with people that are having issues, who's having a heart attack, who's got a common cold, all sorts of different issues. Our staff and our clinicians at BH Link, the only thing we do is behavioral health. So we have all of the services that someone would need to link them up to their next best source of care. And we work very hard to meet people where they're at, what they're looking for in treatment or recovery. So we're not going to be forcing somebody to go to a facility. We're not going to be demanding they go anywhere because our program is completely voluntary. People have to come to us voluntarily. However, if when they're with us, they're presenting a danger to themselves or others, we do have licensed clinicians that could cert them, and then we would send them to the hospital. But my role is in partnership with the Office of Healthy Aging. And what my role is to be working with our seniors who are 60 plus, to talk with them, to see if it's appropriate for them to come to BH Link, to the facility for their behavioral health needs, or if we need to be linking them up to other partners in the community. So I work very much with the Office of Healthy Aging, with their protective service department. I work with community action agencies and case managers that work along protective service, long-term care supports and services. I make visits into nursing homes, assisted livings, high rises, any places where seniors might congregate, live, or be. I'm working with those providers in order to explain to them what BH Link is, to talk with seniors themselves about mental health. I've had some really wonderful meetings at some high rises and some senior centers, talking really in a very simplistic, non-clinical way to seniors about what behavioral health is. And a lot of times, Deb, they don't even realize what behavioral health means. And we've had some really wonderful, meaningful discussions. So my role is twofold. It's one, to help provide our clinicians with direction on what the next best case is for someone who's 60 plus. And then it's also to work with community providers on what the best scenario would be for someone who's 60 plus and is having a behavioral health crisis. And the thing that I like to mention to people that's so important is that when we say crisis, your crisis and my crisis might look very different. My crisis might be, I'm actively suicidal and I have a plan and I want to carry that through. We can meet that need. We will help that person get the care they need. But for our senior population, their crisis might be, maybe they just lost a spouse. Maybe they've had to go from independent living into some sort of supportive housing, and they don't know how to manage the feelings and the emotions that they're having with that move. That could be a crisis. Another crisis could be, we have children that'll call and say, mom or dad is abusing medications. Mom or dad is abusing alcohol. So crisis doesn't mean someone is actively suicidal. Crisis doesn't mean someone is an addict and needs help. Crisis can mean a lot of different things to us at BH Link, and we want to meet that person where they are and help them get the services that they need. So we see people that are 18 plus. Like I said, my role is to work specifically with seniors, with people that are 60 plus. And I'm more than happy to give presentations to anybody that's looking for a presentation. I'm more than happy to meet with seniors at local senior centers. I know a lot of people aren't going out into the community. I still am available to go into the community, or much like this, I can meet with people virtually, and that can have very meaningful impact as well. So I'm really excited. My grant is a 3-year grant, and the BH Link grant is a 5-year grant through the state and through BHDDH. Our goal is to make this program a sustainable program. It's to expand. Currently, we have capacity to see about 7 people at our facility at a time in East Providence. And the goal would be to expand that facility, maybe have some other locations in the state, maybe expand where we are. But the one good thing about our program is that even though we are in East Providence, we are statewide. So we can see anybody from anywhere in the state. And we also have transportation available. We have transportation that can go anywhere from Woonsocket all the way down to Newport in the islands. And so we have our own ambulance service, and we do contract with ambulances. So we not only can bring somebody into our center, we can, if they need to go to their next place, we can get them there, or we can bring them home. So we don't ever want transportation to be a barrier. We can provide that transportation for them. But because we have the 414 link, number, that is something that we can help provide people with services over the phone as well.
That is awesome, Stephanie. And I think that you answered most of the usual questions that come in, particularly in relation to, do you provide transportation? And, if somebody is having a crisis, how long are they able to remain in the BH Link facility?
At BH Link, we can see people for 23 hours because we're not an overnight facility, because we're not congregate facility. We can see people for 23 hours. However, if somebody has not been placed in that 23 hours, we're not going to kick them out to the street and say, oh, we can't keep you. We're going to do what we have to do between paperwork and readmissions to make sure that that person stays safe. If we have to keep them longer than that 23 hours, we'll do that, and we'll give the state an explanation and ask for forgiveness later. We take all insurance, or we take no insurance. So insurance shouldn't be a barrier either. When people come to us, there is no copay out of their pocket for our services. We may bill their insurance, but we take everything. We take Medicare, we take Medicaid. So insurance isn't a barrier to be able to come to us.
That's awesome. So you take all the insurances, you provide transportation, you keep people safe. What if somebody won't leave their house? Are you able to go visit or have someone go visit someone in their home if they're having a crisis?
Yep. So we have a couple options there. We actually just have on staff now a mobile clinician. And so right now she's really sort of more in the Providence metro area, but we're working on getting her to be able to go out. If somebody were to call us, we would do what we could to get someone into someone's home to be able to triage them there. Now, granted, we're in East Providence, so if we get a phone call to go see someone in Westerly, it might take us a little while to get there. But we also work with the SOAR clinicians, Deb, which is the state opioid response team. And the SOAR clinicians, even though it was under the auspices of the opioid response, they are licensed clinicians that we actually work with all over the state. And we can sometimes give them a call at certain periods during the day and we can send one of the SOAR clinicians out to someone's house. So we do have the ability to do that as well. We're trying to work with actually Providence Fire. Zach Kenyon is an amazing partner with us, and he's actually looking for grant money that we can actually send a mobile clinician out with their EMS teams on psych calls. So we're really excited about that prospect.
So it sounds like being grant funded and, you know, a lot of need out there, particularly, you know, people really encountering some mental health difficulties with COVID and the social isolation and loneliness that comes with that. You know, I would say it's probably really important that people reach out to their legislatures and really encourage budget funding for these things. In the long run, and it saves us money.
Right. So part of the whole reason why BH Link was created was as a cost avoidance. Okay. Come to us rather than going to an emergency room. It'll end up costing the state less in the end. But the more altruistic idea is it's a better space and a better option because all we're doing is mental health. So I actually, the grant is held by Horizon Health Partners. And Horizon Healthcare Partners is a conglomerate of 5 community mental health agencies in the state. And they work together to bring better mental health services to the population in Rhode Island. What HHP has been doing, we have interns that work with us. And those interns back before COVID, we were going every Wednesday out to the General Assembly and talking with legislators because we need the legislators to understand that this has to remain a part of Rhode Island's funding. What we don't want to see, and any of you are on the call that have worked in BHDDH programs and state programs for a number of years, what we end up doing is saying, hey, remember that awesome program we had that helped XYZ? We don't want BH Link to become that program. So yes, talk to your legislators, write letters, give personal stories and personal experiences about behavioral health issues, and let our legislators know that this has to be something that comes to fruition to be a permanent part of the state funding, a permanent commitment to the state, so that we're not just one of those programs that was a used to be nice program. And that's not just because I want to keep my job. That's because I really want people to be helped along the way. It's very important. Particularly, again, our seniors. You know, in talking with Jean, you know, I worked as a protective service case manager with Jean at West Bay Community Action. It's very hard to get our senior population to accept, to recognize, to, you know, in their lives approve of any kind of behavioral health care. So these people, what you do, what everybody here is doing is so important to reach out to people so that they can get the help and services that they really need.
This is awesome, Steph. Thank you so much for joining us today. I really do appreciate it.
I have to cut it short, but in the chat, I'll put my contact information. And if anybody wants to reach me via phone or via email, I'm more than happy to talk to anybody. You know, I'll talk all day long. You and I will talk all day long about all of our experiences. And thank you so much for everything you do. That's my kid in the background. Deb, your website is such a tremendous resource for everyone in the state, providers, seniors, their caregivers, and everything. And so none of us could do what we do if we didn't have you. So thank you so much.
Thank you, Steph.
Thanks.
So really bringing this forward and having the virtual senior resource fair, it wouldn't be possible without our sponsors, Oak Street Health, Elder Resources of Rhode Island, Independent Benefit Solutions, Oakley Home Access, Anchor Bay East Providence, Upward Health, Tamarisk Assisted Living, England Studio, and D&B Media. We really do appreciate your support in helping us get this information out to the community. So my next guest, her role is to help ensure that people with special needs get the help they need during a major crisis. Welcome, Andrea.
Hi, good morning, everybody.
Thank you.
I'm going to attempt to share my screen. So. Are we good, Deb? Can we?
I don't see it yet.
No. Okay. All right.
See, sometimes things happen in live video that it's like, oh, well, it worked fine when we practiced it.
It did. Yeah, it did. And now it's not here, so you know what? We will keep going with the flow then. How's that?
There we go.
As Deb said, my name is Andrea Creech, and I am the Internal Planning and Community Initiatives Director for the Center for Emergency Preparedness and Response at the Rhode Island Department of Health. And I'm really excited to talk with you today about the Rhode Island Special Needs Emergency Registry, or RISNR as we refer to it. So in about around 2007, the Rhode Island Emergency Management Agency, along with the Rhode Island Department of Health, realized that the state could really benefit from having a statewide registry of individuals with access and functional needs who may need some additional assistance during a disaster or an emergency. So, you know, they worked together to create this database that now the Department of Health manages. All 39 cities and towns in Rhode Island have at least one or two individuals, usually within the fire department or the police department or the emergency management agency for the city or town, that have access to their city and town's registrants and who has identified themselves as potentially needing assistance in their city and town. So the database is maintained on a secure server. It's very confidential, and, you know, like I said, the only people that have access to the entire registry are a few of us at the Department of Health, but each individual municipality does maintain some access, so that in the days leading up to a hurricane, let's say, a storm coming up the coast, you know, usually we send an email and say, please download your list, look at your list, and, you know, really see who in the community may need some help with the impending disaster. So we enroll people in RISNR of any age, really. You know, babies coming out of the NICU that have some issues, all the way up to our seniors. And people can self-identify and enroll right from our website, or you know, you can enroll your family and friends as well. We also work with a lot of healthcare agencies throughout the state, our home care, hospice agencies, senior centers, all sorts of agencies that are really out in the community doing the good work and talking to people about programs to try and get them to enroll. So, you know, when we talk about the registry, you know, we're really clear about the fact that the enrollment in the registry does not guarantee assistance. You know, every city and town can't go knocking on everyone's door during an emergency. So we do, you know, still really talk about personal preparedness when we're out in the community, because that piece is so important. Being able to be able to sustain yourself for 72 hours post an emergency is really important. So that's something that we also talk about with our enrollees. And, you know, we have presentation that's called Keeping Loved Ones Safe that we give, that is, you know, really talks about this personal preparedness and how important it is for each individual to be prepared so that the whole community can be prepared. So each town is better prepared as every individual is prepared. And that goes all the way to the state and then even nationally. So, you know, we're really looking to identify individuals that have, you know, an identified access or functional need, but we're also registering our elderly individuals that live alone and maybe fine day to day, but, you know, if there's a major snowstorm, they may need a little bit of help. And, you know, like I said, we really work with the cities and towns to make sure that leading up to that emergency, they're looking at the list. Our smaller towns have the ability to call some individuals on a list prior to a storm to ask people if they think that they're going to need anything, or, you know, if they're staying at home or going to stay with a relative. That's a little harder to do in our bigger cities. So, you know, some of those cities will maybe overlay a map of all the registrants onto a map of the city, so that if an area of the city is compromised, they can look and see who's enrolled and start evacuations if possible. So, you know, if you go to our website, there's more information on there, as well as a link to the enrollment form. Our enrollment form is broken down into different areas. So we're going to start asking people about their situation, if they live alone, if they require assistance daily, just some demographic information about themselves. And then on the back of the form, you know, we get into a little bit more about some of the needs that people may have. We want to definitely know if people have powered medical equipment in the home, because of course, in the event of a storm and the loss of power, we're very concerned for individuals that, you know, have electric powered equipment of some kind and what the ramifications are of that during a storm. We also want to know if people have any mobility issues, have trouble getting around. Do you live on the 8th floor of a high rise? And if there's no electricity there, you're going to need help getting down because you're in a wheelchair, for instance. We also look at sensory type conditions, and we ask, you know, if people have a visual impairment or if they're hard of hearing. We also talk about cognitive, psychiatric, neurological, and any muscular conditions, and we ask that people identify those. You know, what we're really looking for is to just provide as much information about someone as we can. The other function of the registry day-to-day is that we are integrated with the 911 system here in Rhode Island. So if someone calls 911 from the number that they've registered under, the top 3 conditions that they've checked on our enrollment form are going to flash across dispatch's screen at 911, just so that our first responders have a little bit better of an idea of what they're walking into in the home. So, you know, we really take the data and cleaning of the data very seriously. We do a lot of efforts to make sure that we don't have duplicate entries. Sometimes a caseworker, you know, helps to enroll someone and they don't remember. So a couple of years down the road, a family member may enroll them as well. So we do go in every month and we make sure that we're clearing out some of the older records if we do have some duplicate entries. We also work with the Center for Vital Records at the Rhode Island Department of Health to ensure that we're matching our list against the decedents list for Rhode Island every year to ensure that we are providing the municipalities with the most up-to-date information on registrants as possible. So, you know, the registry has been used all of these years, and we have a lot of best practices and lessons learned over these years. We've had some municipalities that have, you know, done some evacuations based on our list. We've had municipalities put a generator on the back of a pickup truck and drive it to the home of someone who had electric powered equipment so that they didn't have to leave their home and evacuate to a shelter. You know, more recently, we've used the list during the Newport gas outage a couple of years back. And, you know, they used our list to provide door-to-door wellness checks to some of the people on Aquidneck Island first. So, you know, we've had a lot of good happen from the registry over the years, and we're hoping to expand that into the coming years. So if anybody has any questions, please don't hesitate to reach out to me. I'm happy to answer them. And if there's an opportunity for some kind of outreach, we're happy to do that as well. We do have enrollment forms in not only English, but in Spanish and Portuguese as well. And all of that can be found on our website for download. So it's right there for people that are interested in that. We also just want to take 1 second today to just talk about COVID-19 and, you know, how enrolling in Reisner is one step that people can take to better prepare themselves for a disaster and emergency. But until we have a COVID-19 vaccine, you know, that impacts our emergency plan. So we also need to think about steps that we need to take now, you know, during a possible emergency and how COVID affects that. Make sure that we have masks and extra hand sanitizers in our go kits, etc. So I guess, Deb, I can take any questions now
that was great, Andrea. Thank you so much.
Very quickly.
Yes, no, and I appreciate that. And I found it very interesting that you actually have the ability to provide a generator for people who are in crisis.
We don't have the ability. So that was a municipality had that and did that for someone. So we as the state don't, you know, we don't, we help the municipalities with their lists during the emergencies as needed and provide backup. You know, and if there's a statewide emergency, we would absolutely use that. But it's really up to each individual municipality and how they use it. That was just what a town had done. That was, I think, during Superstorm Sandy quite a few years ago.
Yeah, but I think that also affords a great opportunity for the community as a whole to support one another and reach out to your community and find out what is happening for the folks who live around me who might lose power, and yet they're dependent on, say, an oxygen machine that needs electric, or an electric wheelchair, or a lift that can help them get to and from the bathroom. I'm located up in Scituate, and we lose power pretty frequently. So I think that's really important. And you did say that the list is kept confidential. Is that correct?
Absolutely. So it's on a secure server. And like I said, we do at the Department of Health have to provide municipal access. And that's a list that we review multiple times during the year to ensure that, the partners are still the same, and that, like I said, every town only has access to the people that live in that town, though. So, we do protect the information as much as possible, and we do verify that people are credentialed, within the city or town before we provide them access.
That's awesome. Andrea, I really appreciate you coming on today. This has been great, and I really encourage people to sign up. I know you can do that right on your cell phone, right?
Absolutely. I mean, it's probably a little bit more difficult just because it's a long form. If anybody even needs a paper form, please don't hesitate to reach out to me, and I can mail you one. I know that sometimes access to internet is a little bit more difficult for some people, so we're happy to pop one in the mail. My number is right at the bottom of the screen right there. But thank you so much for having me today, Deb. I'm really glad to be able to talk about the registry.
Yes, no, this is great. Thank you so much. I appreciate you coming in.
Thank you.
So my next guests, they have really provided a beacon of safety for so many Rhode Islanders through the COVID crisis. I would like to bring up Meg Grady and Rebecca Keister from Meals on Wheels. Hi, Rebecca. How are you?
How are you? Good morning. It is still morning.
It is still morning. So tell us about Meals on Wheels.
Yeah, of course. And thank you so much, first of all, for having us on today. Excuse me. Meals on Wheels is in its 51st year. We were founded in February 1969 when Joe Brown, a stalwart community member, saw an unmet need to provide homebound seniors with enough food to eat. So he gathered a group of his friends, really, a small group of 10 volunteers, and they were able to deliver hot, nutritious meals to 17 seniors on a single route in Providence. Within 10 years, they had delivered 1 million meals. And last year, in 2019, we celebrated delivering 19 million meals and counting here in the Ocean State. We're now a statewide organization. We're the only nonprofit meal delivery program of our kind in the state. We deliver from Woonsocket to Westerly, about 1,200 meals each day, although that need, of course, you all know, is continually growing.
So tell me, Rebecca, during COVID, a lot of people just kind of assumed when the senior centers closed and the meal sites were closed that it's like, Meals on Wheels will take care of that.
So as part of our organization, we do operate the Providence County Congregate Dining Program through the Rhode Island Office of Healthy Aging. We call it our Capital City Cafe program. Those are the dining sites that are typically at senior centers, because Providence doesn't actually have a senior center. So they're at 9 community dining sites in the Providence area. Those clients that we have on that program, and last year we served 595 seniors that way, are now receiving meals daily delivered to their homes.
Wow.
Yeah.
So I was reading an article about Meg. Meg Grady, she, unfortunately, because our timing is a little off, I know that Meg had to scoot out, so she wasn't able to join us here today. But I saw that the uptick in meals went from something like 1,400 meals to over 4,000.
Yeah, so typically we deliver about 1,200 meals a day. And at the we surged rather dramatically and very quickly. Of course, adding those capital city cafe clients to home delivered routes adds about another 200 per day. And then from funding with the CARES Act and in coordination with municipalities statewide, we were delivering up to 2,500 frozen meals per day. They are delivered here, and then the different municipalities would come and pick them up to distribute to the folks in their communities who are at the highest risk for food insecurity due to self-isolation. So at the very height of that, we did go from delivering about 1,200 to 4,000 meals per day.
That's amazing. And when you're surging like that, I know a lot of the volunteers for Meals on Wheels, they were older adults, or they are older adults. So how are you meeting the need as far as volunteers? Does Meals on Wheels need volunteers?
Meals on Wheels always needs volunteers. We rely on a network of more than 700 volunteers to help us enact our everyday mission throughout the year. We knew very early on, and I want to say it was just about March 3rd, when Megan and I got together and sat down and said, we need to be prepared because how we are going to operate in response to a pandemic. And a need for additional volunteers was right high on our list because it's comprised almost entirely of senior citizens and members of adult daycare facilities, both belonging to the populations that were identified as being at higher risk for complications from COVID. So we knew they wouldn't be volunteering. So we put out a wide net to, enlist additional volunteers. And the response was tremendous. We had over 500 people inquire about coming on board to join us in being delivery heroes and help us out. And some came from people who hadn't had any association with us. Some people came from partner organizations of ours like Blue Cross and Blue Shield and Neighborhood Health Plan and Citizens Bank. And then, of course, we formed a little bit later on a partnership with AAA Northeast, and they reorganized some of their business to have driver instructors who weren't able to work come and deliver our meals. And then the same thing with RIPTA drivers who weren't working due to reduced bus capacity. So, and then we also did reassign some hours from the development staff to coordinate the frozen meal distribution and the congregate meal distribution. So we had a plan early on, but we were still very, very humbled by the overwhelming response. Now that we are working through our reopening phases and some folks have gone back to work and college kids have gone back to school, we are seeing a new decline in the availability of volunteers. And we are very aggressively seeking new volunteers right now.
So if people wanted to volunteer, what would they need to do? Who would they contact?
So they could call 401-351-6700 and ask to speak with Ozzy, or they could email Brittany Kraft at bkraft@rimeals.org, and she can send them a Google form, which is also available on our Facebook, LinkedIn, and Twitter pages, and they can fill out that interest form.
Excellent, excellent. So, Rebecca, Meals on Wheels, is it a nonprofit?
It is a nonprofit.
And so how do you fund that? When you're surging, when you're quadrupling what you're doing from 1,200 to like so many more, how are you doing that for funding?
Well, the frozen meals were funded. The 2,500 a day frozen meals were funded through the CARES Act.
Okay.
Yep. And we were very fortunate also to get right out of the gate and apply for a lot of COVID-19 relief response grants that we were awarded. So on a normal basis, the vast majority of our budget is made up from state and federal funds, but we still need to raise in excess of $500,000 each year through individual, corporate, and foundational support just to maintain our level service, which is not what we want to do and which is not what our reality is going to be. So we are always seeking new partnerships, new funding opportunities to increase that so we can increase our services.
So how much is it if I'm a senior receiving a meal every day, how much is that meal for me?
So for you, it's free. There is no charge to receive home delivered meals. We do ask our clients to make a voluntary suggested $3 donation when they are able to do so. Only about 10% of our annual operating budget is covered by that client donation income. So we know that not everyone we're serving is able to make that contribution.
So for between $15 and $21 a week, somebody could sort of sponsor a senior's meal, right?
Yeah,
if they wanted to donate.
Yeah. So I'm glad you brought that up. So we asked for the $3 donation to offset the cost of the meal, but the full cost of the meal is actually $7.41. So we always say a donation of just $35 pays for a full week's worth of meals for one homebound senior. And we're hoping that a lot of folks will remember that when they tune in this month, starting next Sunday, October 11th, on Fox Providence, the CW, and my RITV to see our Festival of Meals virtual telethon. I don't know if you were able to come, but last year we had our inaugural Festival of Meals to celebrate our 50th anniversary, to honor our clients, our supporters, and everyone else involved in Meals on Wheels. And we're taking that virtual this year. And so we're presenting a half-hour program where everybody across the state watching will hear directly from our clients about how our programs are helping them to stay happy, healthy, and safe in their own homes.
That's awesome. So I encourage everybody, watch the Festival of Meals. If you are a business, consider allowing your employees to volunteer and drive. If you're able, an individual or business or a group, get together and consider sponsoring a week's worth of meals for individuals. Meals on Wheels really provides more than just meals. You guys also provide that check-in. Just read a story about how the Meals on Wheels driver actually, sees an individual regularly, delivers meals regularly, and when that individual didn't, come right away and do their usual thing, the driver checked on them and found that they had fallen and were not able to reach a phone to get help. And it was because of the Meals on Wheels driver that person was able to receive the 911 services they need. So although we might think of Meals on Wheels for meals, you guys provide so much more.
We really do. And you'll actually hear from that client in the Festival of Meals video. She is 90 years old. And by the time that her driver got there, she had been there for 15 hours. And so it was a really, really critical situation. And she's back home and recovered and healthy. But yeah, it's, the relationship that our drivers develop with their clients it's really remarkable. It really is. They're friends. Our clients, they wait by the window, they wait by the door for a person to come, and that might be the only person they see each day. And so the big smiles, because I've been with them, I've gone and I've seen them, and it's heartwarming.
That's awesome. Thank you so much, Rebecca, for coming. Tell Meg I said hello. Tell Meg I said congratulations on the baby.
I will.
And I thank you. Thank you.
Take care now. Bye-bye.
So I'd like to welcome my next guest, Denise Corson. She is the ATEL Program Coordinator from the Rhode Island Department of Human Services. Welcome, Denise.
Welcome. Thank you, Deb, for having me. I'm glad
to be here
today. So I was going to do my presentation on the ATEL program, which is the Assistive Technology Access. I do two programs. The the Adaptive Telephone Equipment Loan Program, and we're also part of a bigger organization called the Assistive Technology Access Partnership, where we try to educate people about assistive technology. So I do have a PowerPoint. Let me see if I can share it. Let's see if it works. We did do a demo. All right, am I up and seeing it?
It's coming. I see a black screen. It's coming. I see your cursor moving.
All right.
There we go. Something's coming.
All right, let's see. All right.
Ah, yay.
So again, I want to just talk a little bit about using assistive technology to improve communication and independent living. So a lot of times people don't know what is assistive technology. Assistive technology is something that supports people with a disability to reach their potential at home, the community, and the workplace. So it can be all different things that help you achieve those goals throughout your home. Some of the things that when we're talking about our older adults is that we have to keep in mind a lot of them do have disabilities and health issues. I just highlighted that 2 out of 5 older adults have physical conditions and health issues that aggravate the difficulties for seniors using technology. So you have to recognize that these things exist so that you can help them embrace technology and then therefore embrace independent living. So the 3 different disabilities are manual dexterity, being able to hold and operate things, visual impairments, being able to see things and large things, and hearing loss, which is one of the biggest disabilities. Approximately 1 in 3 people over the age of 65 and half over 75 have a hearing loss. So when we talk about using technology, we have to understand that these things exist and we have to address them so that they can embrace technology. For manual dexterity, being able to use switches, a stylist, some of the people that need to use iPads or iPhones and things like that, using a stylist if they have a shaky hand or they can't touch things, that allows them to use that technology. If somebody can't hold something, being able to use some type of a mount to their tables or their wheelchairs. So even though they might have technology, if they don't recognize that they need additional things to make that operable for them. So that's one of the things to keep in mind about manual dexterity. The next thing is vision. A lot of our older adults have vision loss. Realizing in technology that you can increase font size, you can have a bigger display. There's zoom features, even contrasting colors. Sometimes people just don't see well with black and white, and reversing the colors allows them to see better. Screen readers, there's lots of technologies in smart technology that they can read what's being said on the screen. So if they're unable to see it, they can use applications to read it for them. And one of my favorites is the virtual assistants that are out there everywhere. Using Siri, saying, what time is it, or make a phone call, or what's the weather, or turn on a light, so using virtual assistants like the Google Assistant and Siri allows somebody with vision loss or dexterity issues to be able to operate smart technology. Hearing loss is really where my biggest focus is for our program. And again, I told you it is such a prevalent condition with our older adults. And again, if you see, I have highlighted among seniors, hearing loss is the 3rd most prevalent but treatable disabling condition. So it is very prevalent out there. And with communication, if you can't hear, it's really not a viable solution if we can't address that. So these are some of the issues with hearing loss that I like to bring to people's attention. Because I deal with a lot of older adults that have hearing loss, a lot of them will say, I didn't hear you, but really what they meant was, I didn't understand you. And you really do get a different response from people by saying something differently. If I said, I didn't hear you, people are going to yell at me. If I said I didn't understand you, then maybe they're going to pronunciate or use a different word. So I just like people to recognize that when people do have hearing loss, things sound similar. So by using a different word, like if you see it says C as in cat, by using that instead of saying cat 5 times, using a different word might even say, do you have a pet? And they're like, yes, I have a cat. So recognizing that people don't understand everything and using different words is a very good way to deal with people with hearing loss. And this is my favorite joke of all times. It's not a joke, but it's just something that happens all the time, but people can relate to. As you see, there's 3 people having a conversation and everybody is having a different experience. First one says it's windy. Second guy says it's Thursday. And the other one says, let's get a beer, because he thought he said thirsty. So when you don't understand, you have 3 different people in this scenario having 3 different conversations. So that's why I like people to recognize hearing loss is more than hearing, it's understanding. So that's what my next slide is. It's what's people understood. So you have to be able to pronunciate and understand in order to communicate. So that is why assistive technology in many ways is just the way to go for many people with hearing loss, especially our older adults. These are just different devices for if you were to go. A lot of times I hear older adults say, I don't go to meetings anymore. Why do I bother? Because I can't hear anything. So these are some are hardwired devices, like the one on top, the white device. It's a pocket talker and allows you to amplify a person in front of you. And then there's FM systems where the speaker has one part of it and the listener has the other part, and it transmits directly either into a headset or hearing aids. So these things exist out there for communication out in the public. A lot of times, assistive technology for people's homes, they can't hear the TV, it's blasting. By using a headset, instead of blasting the TV, it goes directly into their ears so they're able to hear well. In plays, a lot of times if you ask, is there something for people with hearing loss, there are types of headsets that can be worn in different theater environments. Captioning, there is so much of that, and it is so helpful for the hard of hearing. A lot of, people use the captioning on your television. So turning that on, you might not need to read everything, but having that on when you miss that one word, and it's built into all new TVs. Movie captioning, there's 6 theaters in Rhode Island that have movies with some type of captioning in them. It's not available on any movie, but if there is a movie theater you like to go to and you say, why bother, because I can't hear anymore, ask them what they have for captioning. And there is lots of different technology. Sometimes it's on the screen itself. Sometimes you wear special glasses where they caption on the glasses. Also, our theaters in Rhode Island also have plays that have a LED screen on it. So if you are hard of hearing, you could say, what performance do you have a display so that I can read the performances? So again, it's not on everything, but if you go to PPAC or Trinity Rep, ask them, which shows do you accommodate for that? The other thing is there's a lot of real-time captioning out there. If you go to a meeting, you could go to a meeting and request CART services where the whole meeting is transcribed either on a big screen or maybe on a laptop so that you can read it. Relay services, which is captioning telephones, which is my next screen. This is huge technology, especially for our older adults, again, when it's such a prevalent condition for hard of hearing, that they can make, we talk about telehealth. If you can't understand what your doctor's saying, you're really not going to have a good conversation with them. So what these captioning telephones do is they allow you to hear if you can hear, but if you don't understand, you can actually read what people are saying. And as you see, there's 2 main different kinds of models, depending on if you like a touch screen or a simpler technology. So again, if you're having a meeting with your doctor and they're telling you important information and you're not understanding it, you really are not having a successful visit. But by embracing these technologies, you can have that great telehealth visit. To have the captioning phones, you do have to have both a landline and internet service to have that type of technology. And again, you can get those phones through the ATEL program, which I'll tell you about in a little bit. And there's also federal programs and vendors that you can get these equipment from. And just a general landline phones, just having we talked about relay captioning phones, but an amplified phone that makes things up to 50 decibels louder. For our clients that we serve that are hard of hearing, 90% don't need relay phones. They just need good amplification. If they have a hearing aid in, maybe using a speakerphone, having a flasher so they don't miss the phone call. And one of my favorites is caller ID. By having caller ID on your screen, you don't answer calls, you don't know who they are. And when you answer the phone and you know who's calling you, you know the context. If your doctor's calling, then maybe they're talking about your medical appointment. If your daughter's calling, maybe you're going out to lunch. So by knowing the context of your conversation before you actually answer, you have a better success at having a good conversation. And then smartphones are like for everybody now. Like I said, you know, it used to be just for the younger folks, but now everybody can embrace it. Especially again, I focus a lot on the elderly with the hearing loss. You have amplification, you have vibrating. You can have it vibrate if you don't hear it. You can text if you have a hard time understanding it. You can use relay and captioning services through smartphones. Using a video call like FaceTime or Skype, by seeing people's lips and being able to see their face, you actually can understand what they're saying better. So that really is a technology for people. And being able to get emergency service when you're out and about, having a smartphone is essential. And a lot of the new hearing aids, you can actually make adjustments right on your smartphone. So what is new on smartphones is you actually now don't need a landline phone to actually have a captioning phone call. So if you have these apps, Caption and Caption Mate, if you have them downloaded on your smartphone, you have to have a hearing loss and certify, then you actually can read what people are actually saying on your phone. For in-person conversation, especially like a lot of people are going to doctor's visits or don't have their family or friends around to help translate what people are saying around them because they're not understanding. By having an app on your phone that tells you what people are saying in front of you, you're able to actually have a great conversation. So two of them that are available on both iOS and Android are Live Caption and Otter Notes. Live Caption, again, you do have to pay about $3 a month for it. And Otter Notes, they give you 600 minutes free per month. And then if you want unlimited, it's $9.99 a month. But these are great if you're having an important conversation or just any conversation with a family or a friend and you want to know what they're saying and you're having a hard time understanding. These are just wonderful apps. Android only has a built-in free app, but again, it's only on Androids called Live Transcribe. If you download that app, again on an Android, all your in-person conversations can be captioned. And again, no charge for it. It's a built-in accessibility feature on Androids. And then there's the Google Pixel, which is the best phone for somebody with hearing loss because it actually has built-in captioning of everything. So not only do you have the live transcribe for in-person communication, you have live captions, which they will caption your phone calls, a podcast, an audiobook, any sound that your phone will make, this phone will caption for you for free. So there's any additional charges. And they also on the Google Pixel has something called a Google Recorder, which means that it transcribes without getting sent to a third-party site to translate. You actually don't need internet, you don't need data to do it, and it will give you in-person communication. So again, those are on the Google Pixel. So I just wanted to give you a little bit of heads up on all the different kinds of technologies out there. Our program specific is called the ATEL program. Again, we're under the Department of Human Services. We provide free amplified captioning phones and cellular devices for people that either have a hearing, speech, or neuromuscular disability and make less than $30,000 a year approximately. So if you are a Rhode Islander and you meet those criteria, you can choose one of our devices, either landline or again, cellular devices. We also have a loaner library where you can borrow things if you have a meeting and you want to try out an FM system or a personal amplifier. We have doorbells that alert, fire alarms that alert. So any kind of signaling devices that you might want to try before you purchase, we have that lending library. During this COVID time, we actually FedEx things, so we don't visit anybody at this particular time, but we do FedEx. So we still are in business, but we're just not doing home visits at this time. So this is just a little bit of a picture of some of the devices we do. And one of the other things that we do for people with mobility disabilities, if you see the black phone on the bottom, that's a phone that you can operate. You can, if you have a mobility issue, you can answer and hang up using a pendant versus having to dial. And we also have something called a Freedom Alert, which is a little emergency device that there's no monthly fee, but you have to have a landline and it goes directly to 911. So any of our devices are free. It's just one per household. These are some of the phones and equipment that we offer. The easy to use Jitterbug and Lucia, they're just easy to use phones. And then we do the iPhone and the Google Pixel. So again, any of those devices, we pay for the device itself. We do not pay for anybody's monthly plans. And we're also a part of a bigger partnership called ATAP, and which we are partnering with East Bay Educational Collaborative, OSL, Tech Access, and ORS to provide referrals, technology advice, and if you call the wrong partner, we refer each other out to each other. We just started a Facebook page a couple months ago during COVID called Rhode Island ATAP, where we share information about technology for people with disabilities. And again, if you have questions or want to know what the latest thing going on is, we try to share that information. And the last thing I just wanted to mention is DigiAge that the Office of Healthy Aging has just created to let people know about device access, internet connectivity, training programs, and online content. So we were working with them over the COVID, and it's just a great resource to see what's already going on in our state so that you can find out if whatever you're looking, the information you're looking for. So that's my quick little demonstration there. Hopefully I can start seeing me again.
Hi, Denise, quick question. Thank you so much for doing this. There is a question that did come in. What are the income guidelines or income levels to be eligible for the ATEL program?
So basically it's approximately 30,000 or less for one person, like 40,000 for a family of two, and it goes up incrementally, and it's one per household. So again, you have to be a Rhode Island resident, hit the income criteria, and have either a hearing, speech, or neuromuscular disability, and the device is free from us.
Awesome. Awesome. Thank you so much, Denise. I really appreciate you bringing this on. I know that I have referred people to you and they've received awesome services. And I love the fact that your office can provide a try before you buy scenario. So people can make sure it really works for them.
Well, thank you.
Thank you very much. I appreciate you coming today.
Anytime.
All righty. My next guest is responsible for leading a program that makes technology user-friendly. Let's check out a short video, and then we'll be joined by Sky Liddell, Associate Professor at URI and one of the leaders of the Rhode Island Cyber Senior Program.
Is there anything you would want to learn from the internet?
Could you explain a bit about this Facebook?
Facebook?
Something
Okay.
and having to be a friend?
I typed in www.email.com.
Yeah, that's the problem.
Have you ever heard of YouTube?
Yes, I've heard of it, but I have no clue as to what it means.
How many people here have used a computer? Well, we have some teenage volunteers who are willing to teach you how to use the internet.
I think I'm too old.
Hope you have lots of patience, Henry.
Today we're going to go on Facebook. Do you remember how to get there?
Well, I think I just, no.
Oh, these options I never even dreamed about.
I love it.
Welcome to a whole new world of information.
Every time we're together, Shreya just wants to watch cooking tutorials on YouTube. There's a big game called Minecraft. Maybe we could cook something that looks like one of the characters in Minecraft.
Hi, everybody on YouTube.
We should have you doing a music video.
My teeth are as fresh as hot popped corns. My OG teeth.
Oh,
all of the other seniors are so inspired, so we're going to have a contest to see who gets the most views of their YouTube video.
Hello, YouTube.
Hello, YouTube. Hello, YouTube.
Today we are talking about travel.
Music.
Sisterhood.
Million Evelyn's is beating mine. I need more hits on YouTube.
This is the big moment that you've all been waiting for. The first prize, winners of the Cyber Seniors competition, goes to...
We all know how difficult it is to learn something new, but we really do feel that it can change your life.
So you got a friend request from...
Hello, Yeo. Who's he?
He's in the same program.
Hold on a second. You got a message. Sure, Edie.
Hello, Ellard.
Oh, dear.
Look at here. Ellard is typing.
Oh, hello, Ellard. Hello, Shura. Megan said thank the people who taught you.
You're welcome. Love you. They see a program like this and they think it's an opportunity to get in touch with their grandkids and to communicate.
No matter how old we are, we do need a purpose for getting up in the morning.
Welcome, Sky. Thank you.
Yeah, thank you so much for having me.
Yes, tell us about the Cyber Senior Program. And I'd like to remind everybody, if you do have to jump off, this is being recorded, so you can always come back.
Okay, great. Yeah, thank you. It's perfect to put me right after Denise. We work well together and have coordinated on quite a few projects in the past. So it's great to have the two of us on at the same time. But yeah, so hopefully you enjoyed the documentary. It's really meant to be just kind of some inspiration and to kind of show what inspired us to get connected with this wonderful program. So I thought I would just start with just a little bit of history about the URI Cyber Seniors program. So the University of Rhode Island has a pretty rich gerontology and geriatrics group of faculty who have for many years come together. People are possibly familiar with the Rhode Island Geriatric Education Center, and they provide, lots of great training for healthcare professionals and others across the state. And so it seemed only natural, that we were coming together and collaborating on things and kind of brainstormed that we really needed something to help kind of bridge generations. And so then when we saw this documentary, it just kind of hit us, technology, that could maybe be the thing that could kind of help bring these generations together. And so that sort of started our program. This was back in 2016. And so we connected right away with the Cyber Seniors organization. And so we have worked closely with them in the past, but we really sort of charted our own path in Rhode Island and developed lots of great community partnerships with organizations that provide services to older adults. And so then we had the students at URI, and we would connect with organizations to help provide the assistance for older adults. And so just a little bit about me too. I'm a researcher, and so I'm very focused on social integration for older adults. And so, sort of pivoting to this focus on intergenerational programs, and now this focus on digital inclusion and avoiding social isolation, it's just really, become such a passion of mine. And so we've, like I said, started in 2016, and things have only expanded since then. And so it's a pretty basic program. It's really meant to be a simple program for everyone involved. And so we identify students in need of some kind of service hours. And so students are involved in the pharmacy program oftentimes because they need some service hours for their curriculum. But we also have students in gerontology, human development and family science, health studies, psychology, any major on campus where there would be a student in need of service hours or internship hours. And so then we identify them, and then we partner them most often with organizations across Rhode Island who would be interested in hosting them. And the students then are often just available, to sort of set time each week or virtually as we do it now, but they can meet with anyone who is interested in learning technology. We have different formats that we've used. It just kind of depends on the organization that we're working with. It's most often just individual appointments. So sort of one-on-one where the student is available and the older adult signs up for an appointment. And so it's maybe an hour long time together where they just kind of discuss and share ideas. But we have also partnered with some groups where they provide something more like drop-in sessions, where a student is just available and hours are posted, and so people can just kind of come and go and get help as they need. But we've also done things like small group classes, maybe at a housing unit, or we partnered with PACE to do this in the past, where there's maybe a small group of people who would like to kind of share ideas and work on their iPads or their tablets together, and then have the student sort of facilitate and walk around and answer questions. And that's worked out pretty well. But then we've also done a fourth option, and so we're doing that specifically with the foster grandparent program out of the East Bay Community Action Agency right now. And so that's where we actually partner up a student from a class and then an older adult, and so in this case it's foster grandparents, and they just kind of meet on their own time, and they get assistance with the technology that they're working to use or want to learn. And so we try to be as sort of accommodating to both the student schedules, but then also the needs of the community partners or the older adults who are interested in participating. So we do provide student training. You may wonder, how does this all kind of come together? So the Cyber Seniors organization has put together some online modules. And so every semester we have our students do that training. But then we also meet with them either in person or over Zoom or something like we are doing today, where they just get to meet with us instructors and kind of we essentially just empower them that they can do this and help them kind of understand how the program works. And then we do provide sort of check-ins throughout the semester, usually through a supervisor at the site, but then also from us, so that they feel like they're supported and can share ideas that they have and ask any questions. It's really meant to be a very individualized program. People might think that sounds a little chaotic at times, which it probably is. But it's really this recognition that everybody comes at such a different place. There's some older adults who, are ready to build websites. They're writing blogs. They wrote a book and now they're ready to publicize it. And so they are, tech savvy as can be, but they would just love some kind of help brainstorming or seeing what the latest kind of tech ideas are. Others are starting, very, very new. Like somebody gave me an iPad and I don't even know how to open the box, or what do I do once I take it out of the box? And so we really try to meet everyone sort of where they're at. And so it's why there really isn't sort of a set curriculum that everybody has to get through in order to be in the program. And then we sort of just empower the students with that. That's okay, that's good. And I think that oftentimes helps prepare them to be future health and human service professionals, recognizing that clients or patients or whoever are often at very different places, and you have to sort of think about how you're going to explain the same thing to different people in many different ways. And so we really see it as a great training program as well. It's important to know the students don't come with this amazing tech background. They're not programmers or coders, but we just empower them to problem solve. We oftentimes call them digital natives, sort of recognizing that they've probably had some sort of smartphone or laptop or something in their hands, possibly from birth. And so it isn't necessarily that they're, the most tech savvy person out there, but they're just so used to having to kind of figure it out and problem solve. And so hopefully that's just something they can kind of work with the older adults that come to the program to help them learn too, that it's okay. You're probably not going to break the device. There's probably something wrong with it, or we can figure it out together, or, we can troubleshoot and try this and try this and try this until something works. And so at the end of all this kind of tech talk, it's great to see the relationships that developed. The URI students, just absolutely love getting to know the older community members and vice versa. It's just one of the wonderful things that we often hear across all the generations is just how much they value getting to know each other. And leave with new information and new knowledge that they can take, not only, that they love the relationship, but they can often take to their own relationships with family or other people in the community that they're a part of. And I can talk, just right at the end, just about some ways to either get involved with us, or there is also, importantly, I wanted to mention the Cyber Seniors organization. So they did this huge pivot once COVID time came, And they are now providing a series of Zoom sessions, as well as online phone call and Zoom sessions with students from across the world, actually. And so they have lots of different languages and things that are available for people. And so if people go to cyberseniors.org, it's really that basic, they can get access to these sessions. And so this is either students who are interested or older adults who are interested, or there is a toll-free phone number that could be called just to kind of get in touch with that organization. And so the number for that is 844-217-3057. But importantly, and if people want more of a local approach, we are connected with lots of different places across Rhode Island. And so I thought I would just list some of them here today. So we are working with the Providence Senior Services this semester, AARP. We're working with the Age Friendly Rhode Island Virtual Community Center. We're working with Osher Lifelong Learning Institute. Many different senior centers, so I'll just list the towns: Jamestown, East Greenwich, South Kingstown, Warwick, and then Edward King and Newport. And then we also have partnerships with Brightview Commons. And then we are working with Charles Place in Providence to help with one of the health promotion programs. And so people can get connected to those organizations, and then the organizations can connect them with the student who is placed at their site. But if there's other organizations who are interested in potentially partnering with us, they can also reach out and we can find ways to partner. We have lots of exciting new developments coming into place. Denise mentioned the DigiAge initiative, and so we are hoping to partner with them to be able to provide some iPads to older adults in the near future, and then provide this tech help that I've been talking about. And so stay tuned for that. And then we are also working more closely with the Cyber Seniors organization to develop a more systematic way by which older adults could sign up for a session online and then connect with a Rhode Island student online. As you can imagine, some of the scheduling of this is what gets to be pretty difficult. And so we're hoping that that system might help all of us sort of work more closely together. And so hopefully people can stay in tune for that. And then the last thing I just wanted to mention is just the absolute importance of social integration for older adults and these intergenerational programs. We hear so much about so much of the turmoil and animosity that is, occurring in our society. And it's how programs like this can really kind of help us come together. And then the idea of digital inclusion. I mean, oftentimes, used to get pushback about, well, are we really sure we want everybody to be buried in their phones all day and doing all this tech? And it was kind of like, well, it's what we're doing. It's how our society is functioning. And so it's so important for older adults to be digitally included in this sort of tech world that we have. And so however we do that, wherever we can help and get people more involved, seems like it'll benefit everyone.
Sky, this has been great. There's a number of questions that have actually come in through the chat. One of them is the Cyber Senior Program part of the Osher Lifelong Learning Program?
URI. So the URI, OLLI is what it's affectionately known at, is certainly its own entity. So they have a great, group of educational classes every single semester that people can sign up for. And so, yeah, I certainly encourage people to kind of do that separately from me. We partner with them. And so I work very closely all the time with the OLLI staff and the members to put together programs. And so this is just one of the many programs that we specifically help them with. And then they sort of help us brainstorm ways to make it happen too.
That's awesome. So is there a membership fee for Cyber Seniors?
No, everything is meant to be free. It's a reality. We have, student workers doing it. And so no, at this point, absolutely nothing is costs anything.
That's awesome. So where are you funded from?
Oh, sheer love and passion. I mean, it's the reality that, I mean, I'm faculty here at URI, and so I see it as part of my research, is to be able to put on programs like this. And then, of course, I work closely with Dr. Erica Estes in pharmacy, and part of our jobs is to place students with these different sites. And so we see it as just kind of part of our job is to make sure that students have quality placements. And then we always see that if it's actually meeting a community need, it benefits everybody. I mean, the students, appreciate knowing that their hours aren't, just going to kind of doing, random work that nobody really needs. They love to know that what they're doing is really helpful to the community. And so it's worked for that. We have, received some small grants to do some of the research, and we are definitely working to expand and get grant funding so that, for example, lower income older adults who don't have access to technology or don't have a Wi-Fi connection, so we can get some funding to be able to provide those types of services for people. And so it's definitely something we have in the works. Because as you can imagine, just kind of running something like this, and the bigger it gets, the more difficult it can be to kind of manage. And so importantly, I want to give a shout out to Blue Cross Blue Shield of Rhode Island. They have recently committed to giving us a gift, and which that will enable us to get some administrative help to help make all of this possible, these matches with the students and the matches with the different community partners. And so that's why I'm sort of saying stay tuned, that things should hopefully kind of get to be a little bit more sophisticated as time goes on.
Yep. And Carrie Lynn Venditto Edge had a question. Is this strictly for URI students to volunteer, or can other college students volunteer?
Yeah, great question. Well, we've had some students in the past volunteer from Rhode Island College. At this point, we haven't partnered with other student groups or classes, but it's definitely, we could. That's definitely where we could take this, is getting other colleges, universities, and even high schools involved. We did a little bit of a pilot with actually with Narragansett and South Kingstown High School a couple of semesters ago. And it's just kind of a work in progress. As you can imagine, all this, it just takes a lot of kind of finagling and making sure that we get everybody on the same page with things. But it's certainly something that we could continue to expand.
This, I find your program, the Cyber Senior Program, absolutely amazing. And you mentioned the National Cyber Senior Program, that they have people who are multilingual?
Yeah, so it's an organization based out of Canada, and so they definitely have things in French, but then they've also done their best to have everything available in Spanish and English, of course. But as they're rolling things out, they're adding more and more languages, it sounds like, as they kind of identify the need. And so I don't have the current list of all the languages that they have available, but it can certainly be found on the cyberseniors.org website.
That's so important. One of the things that's really important for RI Elder Info is that we reach everybody who needs the information. And sometimes when you speak another language, that becomes a barrier. And then if you want to utilize technology, if your help is only available in English, that might not really meet your needs. So that, like, having that information that multiple languages are available is super helpful. I really appreciate that information. Like, I think Cyber Seniors is a great program. Vin Marzullo said the higher education could coordinate via the RI Campus Compact.
Oh, yeah.
Not sure exactly what that is, but
I do. Yeah, I worked with them a few years ago. So yeah, that's a good idea. Something we can certainly explore.
Yeah. So I really appreciate you coming on and sharing this information today. I know sometimes it's hard. It's the last one of the day, but this has been amazing. I really appreciate you taking the time to talk about this today.
No problem. Thanks so much for having me.
Thank you. And thank you, everybody, for sticking with me. We did run over a little bit, but I think it was 100% worth it. I hope you liked our event and that you will share the event. RI Elder Info will continue to bring you the information and resources you need. To be sure, you want to hit the follow button so that you don't miss anything. You want to make sure to visit rielderinfo.com for even more information and resources. Our next event is tomorrow morning at 9 a.m. Every Friday, we host Friday Friends, an interview show with local organizations that are doing some really cool stuff that you need to know about. We have more great events being planned, so be sure you sign up for one of our newsletters. There's one for seniors and caregivers, and there's one for professionals. Lots of great stuff coming up. Today was wonderful. I am so grateful to my presenters. I hope you all found, the answers that you were looking for and that you share this widely. The Virtual Senior Resource Fair would not be what it is without the support of the Lieutenant Governor McKee's office and the support of our sponsors, Oak Street Health, Elder Resources of RI, Independent Benefit Solutions, Oakley Home Access, Anchor Bay, East Providence, Upward Health, Tamarisk Assisted Living, our web design team at England Studio, and the fabulous Ben, who's been working behind the scenes like crazy this morning with D&B Media. I thank you, everyone, for joining us today. Stay informed and stay empowered. Thank you.